Good evening, everyone. Welcome to the fourth episode of Learning and Perfecting Cataract Surgery Training Opportunities, the Module 12 of Kerala Society of Ophthalmic Surgeons Scientific Committee CME series. I'm Dr Sreeni Edakhlon, Chairman of Scientific Committee of Kerala Society of Ophthalmic Surgeons. We, the Scientific Committee of Kerala Society of Ophthalmic Surgeons, we have been regularly conducting CME programs over the past 1 year and a half, and our programs have been very popular. Some of our programs have even crossed 7,000 plus views. In fact, this is the fourth episode of the program on the training opportunities that are available in the major institutions across India. So what I have asked all these institutions who are participating in this program to share with all the young postgraduate students and the young ophthalmologists who really want to learn cataract surgery and perfect their cataract surgery, is to really explain what are the training opportunities available in these institutions. Do they have long-term fellowship, short-term fellowship, paid fellowship, very short fellowship, 1-2 month fellowships, and what is the stipend available for them? What are the leave rules available to these postgraduates, the trainees when they are undergoing the training? And if the institute, like Dr. Mamatha did from Lions Hospital, and she continued there, and now she heads that institution. So what are the growth opportunities available to these youngsters if they complete training in those institutions, whatever, everything about them, and with specific interest on the female ophthalmologists. See, I started this program basically with these girls in mind, because in Kerala, more than 95% of the postgraduate students are girls. And obviously, they have to get married at the end of their post-graduation. They can't go for, unlike boys, they can't go for fellowship as soon as because they start their family, have kids and all. So I just wanted to give them an idea as to what all training facilities available across India. Because we have been concentrating on the institutes in South India. I've just given them a view of what happens in North India, like the training opportunity available in Shroff. That was a real eye-opener for us. And the Sri Eye Hospital and other hospitals in North India. See, it has been a great journey for me, these 3 episodes. And the third episode, which I did, has already crossed 3,000 views. So today we have another 6 major institutions sharing their whatever training opportunities are available in those institutions. Lions Super Specialty Eye Hospital Bangalore, PGI Chandigarh, Nandadeep Eye Hospital Sangli, Mahatme Eye Hospital Nagpur, Rajan Eye Care Hospital Chennai, and Shri Ganapathi Nethralaya, Jalna. So today we'll start with Dr. Mamatha, who will be talking about the opportunities available in Bangalore Westlands Super Specialty Eye Hospital, which is a landmark institute in eye care in Karnataka state. Because I've met and I've seen and experienced the skill of a large number of surgeons who have got trained in the Westlands Hospital, and the training there is absolutely wonderful. Because you understand it from the quality of the surgeons who have come out from there. And this is a wholly charitable institution which has completed 38 years of service to the people of Karnataka. And it has satellite hospitals at Kollagal and vision centers at 3 other places. And the Lions International Eye Bank is an extremely successful eye bank in India, in fact. And Dr. Mamatha, who took over as medical director, and she's still the medical director there, did a post-graduation from Mysore Medical College, and after completing general ophthalmology fellowship in the Lions Super Specialty Eye Hospital in 2003, joined as a consultant in 2004, and So after completing our RGUHS affiliated fellowship in cornea and anterior segment in 2007, continued as cornea and cataract consultant. I'm sure, like what I had in mind, everything she has. She is a lady ophthalmologist. She has come up ranks, did training from the same institution, continuing in the same institution. Dr. Mamatha, please explain regarding the facilities available in Lions Hospital for all these kids who are watching.
Thank you, Dr. Sreeni. Thank you for that wonderful introduction. Good evening, everybody. First of all, I would like to thank Dr. Sreeni once again, and also the KSOS for giving us this platform where we are going to portray our training opportunities available at our center. And before that, I want to congratulate Dr. Sreeni, for this wonderful, innovative move. It is such a nice opportunity for people or students who have just passed out their this and want to improve their surgical skills. They get so much of information here. It is not only for those students who are seeking opportunity to increase their surgical skill, but also for us like institution, when we also sit and watch these programs, we'll also get to know the training module which is followed at different premier institutes, and also we can learn from them and also make necessary modification in our training modules as well. Both ways it is beneficial. Yeah, I should congratulate you. It's a very innovative move actually.
Thank you.
And coming back to our center, we started training the students way back in 1987. And then we trained the DNB candidates also. We are recognized by the National Board of Examination. That was also from 1999. And the university affiliated fellowship we started from 2005, and also the short-term FACO fellowship also around 2009 and 10 we have started. And so this is how it has been going on, and it was very nice to hear that the students who have gone through the training here and then are really doing well. Of course, they are wherever they are all well settled. I'm proud to say that. So, the training module has been so meticulously, planned and structured with the intention of making the trainee to achieve overall expertise. It's just not the surgical one, and clinical as well as surgical expertise, especially the long-term fellowship ones. The short-term fellowship, anyway, we'll be going through that part in detail. I actually have Dr. Rachana with me, our consultant, who will be taking us through the details of the different fellowship we are offering at the center. I'm handing over to Dr. Rachana. Rachana, you may proceed.
Hi, good evening, everyone. Thank you for this wonderful opportunity. Is it visible? Is the screen?
Yeah, Dr. You can go ahead.
Yeah, thank you. So our center, some of the key aspects of surgical training that we have full-fledged wet lab facilities where the students can practice before they start operating on patients. We also have individualized training with constant supervision. And the training is done by experienced surgeons with emphasis on learning the correct techniques. We also have recording facilities so that the students can go back and watch their surgery videos, and they can review the techniques and approach the consultants to correct any mistakes. And we also have a large number of cases and plenty of academic sessions to complement the surgical part. So the opportunities that are there for students to learn here, one is we have the DNB program, which is recognized by the NBE, and the Comprehensive Ophthalmology Fellowship, which is for 1 year. We have university recognized fellowships in phaco-refractive surgery, cornea refractive surgery, glaucoma and vitreoretina, which are all for 18 months. And we have a short-term phaco fellowship, which is a paid fellowship. The DNB, coming to the DNB surgical program, I'll just talk about this in brief. So basically the surgical training program for DNB students, it includes screening patients at camps, and preoperative evaluation. They go through a gamut of slit lamp examination, IOL calculation, fundus evaluation, etc. And then we also have a intensive training in small incision cataract surgery. So for primary DNBs in the initial 3 months, they undergo supervised training at the wet lab. And we also post them in the block room where they learn the technique of giving posterior subtenance anesthesia. And in the next 3 months, they assist the consultant during the cataract surgery, and they start doing initial steps of surgery with the consultant's guidance. And from 6 months onwards, they start operating initially under the guidance of a senior resident, and then they start operating independently, and they take help from the consultant in charge whenever it's required. For secondary DNBs, because they've already done their DOMS elsewhere, they have some sort of holdover SICS. Maybe they need just correction of some techniques and to improve their skills. So the initial 1 month, they undergo supervised training and block room postings. And in the subsequent months, they start operating independently, maybe first under the supervision of a senior resident, followed by, independently just taking help whenever required. One of the key aspects is that our students, they maintain a surgical logbook, and we assess their competency via the ICO Oscar scoring. So this scoring is quite comprehensive, and for each step there's a scoring, and we can decide if the student is a novice or a beginner or an advanced beginner, or if they're competent. The goal is so that once they approach the end of their training period, they should reach the level of a competent surgeon. We also post students for post-operative follow-ups, and they get to see their own, the surgeries that they have performed, how the patients are doing in the follow-up period. And primary DNBs in our institute, they can expect to complete around 450 to 500 SICS at the end of their course. And secondary DNBs, in their 2 years, they can complete around 300 to 350 SICS cases. Coming to the Comprehensive Ophthalmology Fellowship, this is a fellowship that is for 1 year, and post DOMS, MS, or DNB candidates can apply. So they can submit their CVs either in person or email it, and the selection is done after an interview process. And the intake is usually twice a year, once in January and in June. This fellowship doesn't require any fees to be paid. So what can students expect to get out of this fellowship? First, they get to, they're posted in subspecialty OPDs like cornea, glaucoma, retina, pediatric ophthalmology. They'll get to upgrade their clinical skills and examination techniques. They learn how to interpret different ophthalmic imaging reports. And they're also posted for screening camps, and they're involved in the preoperative workup of patients. They also undergo an intensive surgical training program, which includes block room postings, and they assist the consultants initially, followed by, they start operating independently. And we encourage them to practice in the wet lab as much as possible. These students are also posted to post-operative follow-ups. And the additional thing is that they're posted even in our peripheral OPD postings. So this is an opportunity for them to manage patients independently. And they get a nominal stipend, and the fellows can expect to complete around 200 to 250 SICS and around 10 phaco cases at the end of their course. This is not, and this is in 1 year's time. And there's no fixed limit. If they're doing well, they can even go more and beyond, do more and beyond the allotted number. Coming to the phaco refractive surgery fellowship, this is a university recognized fellowship, and it is for 18 months. The eligibility for this is MS, post DNB, or even post DOMS with 2 years of experience. Again, the application process is similar. The intake is only once a year in July or August, and this is for 2 candidates at a time. And there's a rigorous interview process where the internal and external faculty are appointed by the university. And there's a nominal fee which has to be paid to RGHS, the university, and to the institution. The surgical program is similar to the Comprehensive Ophthalmology Fellowship, except that the number of cases that these 2 fellows do is usually more. And we ensure that each candidate is able to operate at least 5 cases per OT at the end of 6 months, 8 cases by 12 months, and 10 cases at the end of their course. This is the training facility for SICS in our free camp setup. We can monitor the students through the video and through the live monitoring, which is there through the video assisting. And the fellows also start getting trained in phacoemulsification after 3 months into their course. And this involves a step-by-step learning with constant supervision. There's one-on-one teaching with experienced phacosurgeons. Again, we assess their competency via the ICO Oscar scoring. And these fellows also actively take part in the preoperative and postoperative follow-up as well. And they get a nominal stipend, and they usually are able to complete around 400 to 450 SICS and around 50 phaco cases. This includes even clear corneal incision with foldable IOLs. Coming to the short-term phaco fellowship, this is a paid phaco fellowship, and it is for 45 days. One of the main prerequisites is that they should have some level of competency in SICS. The application process is similar. There's an interview process and to judge the candidate's expertise in SICS. And, there's usually a waiting period, and currently it's around 6 to 7 months at our institution. And so what can these candidates expect? They can expect very exclusive one-on-one training in phaco emulsification by experienced phacosurgeons. They get around 25 cases, out of which 15 cases are with rigid IOL, because they're still, in the learning process. And after which the next 10 cases, they'll be doing a clear corneal incision with foldable IOLs. Thank you. So we come to the end of the presentation.
Thank you. That was a comprehensive presentation. See, one thing I wanted to know is for the long-term fellowship. So what are the leave rules like?
The leaves during the fellowship, the leaves, unnecessary leaves we don't usually entertain. And the hospital has usually Sundays we don't work, and on rotation they occasionally get duties. Duties will be like once, probably twice in a month. And so the leaves, only emergency leaves are allowed.
Okay, that's fine. And do they have to go for camps?
Camps as in for the screening? Yes, screening camps, yeah, they do go.
So how far do they have to travel? Because when I was in Chandigarh, see, I did my post-graduation from RP Center and did my fellowship from Chandigarh, Coimbatore. So we used to travel like long distances, and used to go and stay there, do the camp there, then go to another place, stay there, do the camp on. So what is a camp? So they just go for the day and come back, is it?
Yes. It is only for the screening purpose that they go. And as we told in the long-term fellowship, we have our peripheral vision centers. So they will have to go there, and also they'll be seeing the OPD. So operations are the free, this one surgical exposure for them will be at the institution only, at the center only.
Yeah, that's fine. Even for us, it was just a screening camp, and we used to bring back patients and big buses and all. So this is. I'm just asking you because, as I said, I'm just targeting girls here. So the travel and stay and also that's why I asked. And this is what I keep asking everyone: is there any special leniency for girls?
Leniency in what sense? Lots of leniency is given to hardworking, dedicated people. That I should say. Okay.
No. See, the reason why I asked is I went for the Jaipur conference, and came back, and I had that connecting flight in Bangalore. So in that bus from the airport to the flight, so I saw a girl standing with a 4-month-old baby with a husband, and she was saying, "Hey, that is Dr. Sreeni." So I overheard it, and I went to her, and she's basically a Malayali who did her post-graduation from Maharashtra and now settled in Assam. So she saw me from this program only, And she said, so you asked whatever we wanted to ask. So we want to, as girls, we want to know all those things. So that's the only reason why I
Okay.
asked. And
What?
it is really great. Like yours is one of the very few fellowships that has got a university recognition. So that is great. So they get a university certificate for it.
Yes.
That's absolutely
They'll have.
wonderful.
One more thing we actually forgot to mention, these university fellowships will have exams at the end of the course. So it will be almost like, in their specialty, they will have the theory exams and practical exams. And also during the long-term fellowship course, they have to work on a thesis project and they have to submit it by the end of the course. That is also there.
Yeah, that's
So like
that's
as I told you, it is like, overall development, improvement in the clinical as well as in the surgical expertise. So
yeah, but do they get exposure to other specialties like glaucoma surgery, something like for the overall development?
see, if it is a phaco-refractive, or if it is a like cornea refractive or a glaucoma, so those specific more exposure will be given to the specific this one. But then they also do get rotational posting in the other department, but then nothing, no surgical exposure. And they would have also come with a specific intention of learning only phacos and refractive surgery. So they are also not bothered about doing any corneal transplantation or anything. So the surgical exposure is limited to that particular specialty. So, but then the OPD during this one, into the different departments, so they do get rotational postings.
Okay, like do you have so didactic lectures or rounds for these people?
Yes. We actually thought it is mainly about the surgical exposure, and we didn't concentrate on that. But regular lectures, seminars, and all that, that's part and parcel of the whole process.
Okay. No. I just wanted to know like the overall training program. And see, can you please tell one second, like for the long term program?
Yes.
You first start with the wet labs.
Mm-hmm.
Okay. So is there like from RP Center, Dr. Tushar was the one who led this thing, and he said they have a program there, the wet lab, where first they have a certification. First they make them do ECC. So RP Center still is not a fan of SICS. So that's a different story. Okay. Now, so ECC, and then they get a certificate. Okay, he or she is good in, mostly she, good in ECC. Then they are made to do phaco on the God size. Then they get a certificate. Then they get to do supervised on human eyes. So that is a program. So what till what stage do you make these youngsters do wet lab before they touch the human eye?
Yeah. I would like to answer it too. This one. One thing is, I watched your this one, whatever episode you were mentioning, and then that is the reason why I told you we as an institution get to know what is the teaching modality other institutions are following, so that we can also adapt some of the changes and make some changes. So we don't have any certification of the wet lab training and all that. So we do have it as a monitored wet lab training. So that is whatever, if it is like a 1 month or if it is a primary DNB, they will go on for the first 2 to 3 months. So the training is under the one deputed consultant will be there. And the training, they have to show a minimum of 20 cases. So we have, since ours is a international Alliance International Eye Bank, I'm sure most of you might have heard about us. So we do get a lot of tissues, and there are many a times some of the tissues are not usable for not used for transplantation purpose. So in such cases which are not suitable for any kind of surgery, we use them for training the students. So at wet lab, they get these cadaveric eyes on which they will be practicing their tunnel making and then the flipping, the rexis also sometimes by scraping the epithelium. So all these cases, they do about 20 cases, and they have to show it to the consultant and respective consultant. And then if the consultant says okay, then they start off. they start off. So here it depends upon like, whom we are training. So if it is a 1 year comprehensive ophthalmology, usually they are postgraduates. They have completed either their DO, MS or MS. So some exposure to the surgical techniques would definitely be there. So this wet lab training, I feel with the 20 cases, doing 20 cases, and then like they can go on to the actual human eyes. And they start with steps. They start with steps there. The first case, they start with steps, and always that is the specialty. I would like to overemphasize on that fact that always there is somebody monitoring during these initial phases. So it is it's most of the times a senior resident, and nowadays because we have a shortage of senior resident, the consultants themselves stand with the student. So then the initial steps are monitored, and the most of the times if it's not a very skilled surgeon, it will be like, the first case might be limited to the just the tunnel making, and then the consultant takes over. Sometimes such things also do happen. But then if you have done the wet lab training 20 cases neat, so then they should be able to do most of the steps. That's what usually happens. So that's how it is. But each and every step is monitored in the initial phase stage. And then when they move on to the more number of cases, like from 1 case to the 2 cases stage, when they are able to complete the first case, so they usually move on to the 2 case stage. That is when they are allowed to like, operate independently, and simultaneously the consultant is also there around, and they will be called only when the help is needed. So that time when they make it to operate 2 or 3 cases, that time consultant won't be monitoring them. So otherwise, there will be continuous monitoring.
Do you
And
do
as
you do you video record all these cases?
yes, yes, yes,
And
yes.
so the trainer or consultant goes through these videos and
Yes, they do that. They do that, and also the whatever the score, the Oscar scoring system and all that. And then the complications, the consultant in charge on the next day with the after the postoperative rounds, she goes through all the this one all the students complications list, and whatever the short discussion happens then and there itself. So that ends the responsibility of the consultant, like, from the preoperative responsibility to during the on the previous day to the whole day in the camp, being in charge of the camp and all the students monitoring, and next day completing the postoperative rounds and discussion with the students. There it ends. So then it so happens so many times, if at all there are any complications, even I make it a point to see them. So any cases who have undergone complications, they invariably on each and every camp they come to me, and I also monitor their management. So it is just not the exposure to the students that we are intending, or we also are very particular about the patient care and the outcome what we give to the patients.
really like see that's a very important point. See, when you do it on these poor patients and the camp patients, it's not just a relationship between the doctor and the patient. It's a relationship between the doctor, the institution, and the community. So it's a huge responsibility, and I tell all my juniors, like, I would always be much more careful, much more meticulous with a camp case than a paying case, because that's just a paid relationship between the doctor and the patient. Here it's something much bigger. So that is very important. So regarding the short-term fellowships, so how frequently do you take them?
It is like, there is a waiting list. So unfortunately, we have about 6 months waiting period now. So as and when the applications come, and then like, it's according to the waiting list, it moves on.
So how many do you take?
Two people will be there at a time, at a given time.
45 days, right?
45 days, yes. Okay. And I would like to emphasize here again, I do not know definitely about the other institution here, though it is like an experienced consultant standing next to the student throughout, and all the 45 days of whatever how many of cases, fixed cases they have, and for all the cases they'll be there. We somehow usually don't allow them to like, operate. Okay, fine, you are good enough, you operate, and then I'll be doing something else. Not that way. The FACO part, they will have one-on-one teaching. So the monitoring is there throughout.
So do you?
I'm fortunate to have such good consultants who are dedicated and passionate about teaching this one. Of course, sometimes it's a very tiring job, but then they do that.
It definitely is. I would love
It's
to
a
be
very
a teacher.
tiring job.
I'm basically a surgeon only. So I love people who teach, because it requires a lot of patience. It requires a lot of dedication.
You should be
So
passionate about teaching.
yes,
Otherwise,
yes,
it doesn't
yes,
come.
yes.
Just a patience doesn't work there.
Yeah. So like so I was see I started this program with Dr. Pani. See, basically I went into this program as a training program, Singh, when I actually talked to Dr. Paneerselvam of Rajan Eye Institution. So when he is so senior and so passionate about teaching, and he is there. He's there always with so senior, and so that is a sort of passion that we need for the teachers. And I'm happy that the Lions Eye Hospital has a lot of teachers, and that is why the products that come out of Lions Eye Institute are of that high quality. Thanks a lot, and the contact details are there.
Another reason maybe for this is most of us are from the same institution.
That
is why we know what we have gone through, and then we we carry that passion. We imbibe that passion from our teacher, and then we just continue to give.
No. That is extremely important. See, as I said, I did my post-graduation from Rapid Center, and then I did my fellowship from Shankara. I'm one of the most pampered fellows from Shankara. And after that time only Coimbatore was it. Now it has grown to be one of the largest eye hospital groups in India. But still, see, I have such passion for. I love to see the growth of Shankara. See what you are made is what you become is what your institution has made you to become. So that is what has happened to you people, and that is what has happened to the other people. So you will definitely listen to Dr. Ramandeep Singh, who actually did post graduation from PGI Chandigarh, and has been instrumental in starting many training programs in PGI Chandigarh. And thanks a lot, Dr. Mamatha. Thanks a lot to Lions Eye Institution. Thank you for joining us. I know that you have your child's exam going on, and thanks a lot for taking your time to join us. Thank you. And
thank you so much for the opportunity. It was very nice to interact. Thank you.
See, I'm loving this. I do a lot of CME programs, and this is the fourth one. See, I'm sitting throughout because I'm enjoying a lot. I'm learning a lot. So, like in the last program, Dr. Nivian was there. He's a good friend, good brother of mine, and he sat through the whole program. And finally, he was the one who summarized the whole program for me. So that's so I'm enjoying this, and thanks a lot. Thanks a lot to both of you. Now we'll move on to the presentation by Dr. Ramandeep Singh for PGI Chandigarh. So PGI Chandigarh definitely is one of the major premium eye institutions in India, and it's a dream of any postgraduate student or anybody who wants to do ophthalmology to be trained at PGI Chandigarh. And Dr. Ramandeep Singh will be presenting on the training programs in PGI Chandigarh, and he's a professor at the Advanced Eye Center in the subspecialty of Patwardhan and Uvia at PGI, Postgraduate Institute of Medical Education and Research, Chandigarh, India. He joined postgraduate in ophthalmology in PGI Chandigarh in 1998, and after residency, he did his senior residency in Patwardhan and Uvia and a research officer job under the legendary Professor Amod Gupta to 2006, and then he joined as an assistant professor in ophthalmology there itself in September 2006. So this is the most important part. He, along with the whole retina team of PGI and mentors like Dr. Amod Gupta and Professor Mangat Ram, was instrumental in starting the first super specialty program in ophthalmology in any government institution, that is MCH in Patwardhan, a 3-year course in India. So he has a huge lot of publications, 207 publications in various international, national peer-reviewed journals. Among the various national and international awards, the most prestigious are the JM Pawa Award by VRSI in 2007 and Best Paper Award by American Academy in 2014. He's a scientific reviewer for major national and international journals. Dr. Ramandeep, can you please start your presentation?
Yeah, sure. I'm audible, Chief. Dr. Sreeni, I'm audible. Dr. Sreeni, I'm audible.
Yeah, you're audible. I muted myself. Sorry.
Sorry, I'm sharing my screen here.
Okay.
So, yeah. So can you see it?
Yes, screen is visible. Please go ahead. Maybe you can sit a bit closer so that the voice is a bit louder.
Yeah.
That's it.
So, hi everyone. This is I'm Ramandeep from PGI Chandigarh. So, since Dr. Sreeni told me that we are talking about cataract surgery training opportunities in, my talk will be not on my VR training part. That's a long story how I went into cataract surgery training also, and I'm trying to do my best there. So, for the PGs, the Chandigarh is north part of India, above Delhi. So we have a beautiful city of something like 13 lakh people only. So we have beautiful gardens, parks, and everything here, and we have lovely weather. But in June it goes to the extremes, and in winters it's extreme. People come here for visiting a lot. And we are lucky to have 3 premier institutes, an engineering college here, a university here which is of the world level, and of course the PGMER is there. And this is the whole campus of the PGMER. It is an institute which started in 1962, an institute of national importance. So it is run by the government of India, and this is where we are. This is the Advanced Eye Center, and this is the building we moved into in 2006. The eye department was there since 1962, but we moved into this building in 2006. This is since 1962. We owe them everything. But these are our teachers there, and we happen to have our first director, Dr. Tulsidas. He was happened to be a HOD in ophthalmology also. So we owe everything to our teachers who have mentored us and made us what we are right now. So coming to the programs at AEC, since I told you that we are a government institute, so most of the training programs are the trainees can join through a national level entrance test only. So we have this Master of Surgery in Ophthalmology. This is the main postgraduate program. It is a 3 years postgraduate program in ophthalmology. And apart from that, the other programs which have started recently in 4-5 years is MCH in cornea refractive surgery and cataract surgery. Again, it's a 3 years super specialty program after the PG, and they also come through a national level entrance, which is a very highly competitive exam. And again, I'm instrumental in this program, Master in Vitreoretinal Surgery. And then again, a 3-year program after the post-graduation. And there is a one fellowship in glaucoma also there. This is a one-year fellowship program in the glaucoma there. And this is again a national level program there. And as highlighted that I'll be talking about the Masters of Surgery in Ophthalmology. Masters of Surgery in Ophthalmology includes all the branches of ophthalmology, of which a cataract and cataract surgery is a part of the training, which I will be talking about. How do we go about in our institute in PGI, so that residents are well versed with the cataract surgery by the time they leave this institute actually. So this is the, whenever there's a surgeon who is getting trained, this is what I tell them. Remember Hippocrates, he said, do no harm. And that is most important. It's not that we are going to operate anyone's eye without a proper training, and you should not do that because you don't want them to happen to us also. So do no harm. Always remember that. This is what we always believe. That is why this whole program is all onwards. Though the cataract surgery was going on since 1962 in our department, but the major changes and a program took over in somewhere in 2018 because of the various reasons. I'll be talking about those. So this is the program we run since 2018, in which we have a simulator training, and we have wet lab and skill transfer lab, and then we have cataract surgery training. And when we talk about the simulator and skill transfer training, and basically the 6 years, the 3 years program is divided into 6 semesters. So every 6 months, 4 to 5 people join our institute every 6 months. So the simulator and the wet lab training is right now is for first 3 semesters. So first 18 months, they are given this training for the cataract surgery. And there are 3 levels for that. The first semester, and the second semester, and the third semester. And dedicated tasks are given on the simulator, on the animal eye, or the phaco training, on the goat's eye, or the Madhu eye. And there is always an exit exam. Like we give a certificate to them whether he or she is ready to do a surgery on the human eye or not. If they are not ready, then they are assessed at every 1 month, and then they'll be cleared once they clear the exit exam. This is much like Dr. Tushar, and I must congratulate him because he has done a wonderful work, and we have somehow the program is almost similar, but we are in a very initial, in the baby steps. So this is how a simulator looks like. You can see the residents working on the surgical simulator. We are very, very lucky to have a cataract surgery simulator and a vitreoretinal surgery simulator. You can see that the simulation is based on the principle of the way the aviation simulator works. So a resident is given a situation which is similar to the human eye, and these tasks become difficult and difficult once he clears that. And the steps like the CCC, hydrodissection, hydrodelineation, chopping, IOL insertion, IA cortex, and he can actually do it n number of times and be a master of these steps when he goes to the human eye or after completing the simulator course. So this is one such video which is showing that how it looks like, and this is again this is a wonderful tool to have in a training of the cataract surgery. So as I've already said, that simulator is a tool which gives a training, and how a mentor or like me can assess the training part that is also very important. This is a mentor window which is available on my computer all the time. So a cataract program is divided into cataract A, that is introduction, the beginner level, the intermediate level, and the advanced level. We expect our residents who are going to the human surgery to complete at least cataract surgery intermediate level. Only then they'll be allowed to do that. And you can read that the cataract surgery introduction will have their anterior chamber navigation skill, the intracapsular navigation, the bimanual navigation. So all the steps which are required for any good stereoscopic surgery are there. And again, in the B, you can see the capsular access, your steps for lens removal, the intracapsular tissue, stop and chop, IOL insertion. And as the trainer advances, that keeps completing these steps, there is no way that he can skip these steps and move on to the other step before completing the course. He has to complete this course. And this again, CAT C, the difficulty index is increasing as he is moving. The machine will give him the harder cataracts, the machine will give him the harder situations, and depending on that, he will be allowed to move this to the next step. And see, you can see in the advanced D, he will give you the situation where the zonules are weak, he will give you the capsular plaques, he will give you the white cataract, he will give you every situation which a surgeon can encounter while he is doing a cataract surgery in the human eye. And this is how it really helps to build a mentee there to skill. So this slide is just to show that there's a core score. So if a candidate is not scoring more than 60 for 3 consecutive times, he is not allowed to pass. I have done these simulators, VR and cataract myself, and it is very difficult. And it is known in the aviation industry also. If you can do an aviation simulator, I mean, you can fly in any situation. So same, I believe, in cataract simulation is also going to be the same way, because the difficulty index and the time spent, the number of hours spent, are really helpful for the training. And this is my window where I can see what all whosoever is in cataract B, cat C, I give them regularly the warnings that they're going slow, they should do early. I always tell them to don't do it like don't binge on it. So always do in steps. So I always watch that somebody's binging, somebody's starting doing surgery at 8 o'clock in the morning and try to finish all the modules. We have TV cameras installed in that room to see that if somebody is not binging and somebody's other person is doing the procedure for that person. So this is all we are making sure. Residents are asked to complete simulator training intermediate level. They have to complete CAT C till the 3rd semester, and they have to be certified. I have to see that value here. They've done that, only then I'll allow them. So as they are doing their simulator training, they are also doing these wet lab training. Wet lab training, we are fortunate to have these instruments. These all instruments came in somewhere in 2018 and 19. That is why I'm saying that 2018 was a time when we really pushed towards the proper cataract surgery training of our MS residents there. So we have these 3 operating microscope with the assistant microscope, with the recording there. Everything is available to us. And we also had these table mounted microscope, which were there with us since 2010, and they're also there. So in total, we have 7 operating table mount 7 microscope for the wet lab training. And of course, we have goat eyes, we have eye stands, we have everything available for these. And we have this fridge and a microwave to harden the cataract, so that we present them with the situation. During the COVID era, we came to know about the Madhu eyes, and we are regularly using Madhu eyes for doing a phaco there, and it's an excellent tool to teach they can feel the tissue right there. Though the capsulorhexis part is not that great, but the phaco part is the trenching, the chops. It's excellent tool to teach the mentees there actually. So this is how we have 2 dedicated phaco-wit machines, because I said we are training the VR surgeons also, and this is how a resident is getting trained, and the mentor is also standing there. And this is again an activity which is done on Saturdays. You can see the mentor is watching whatever is been done and telling to make changes, how to go about. We have the facilities to record also in this lab. See, it is full of activities there on Saturdays. Everybody's, because on Saturdays we start with the VR training, and we start with the cornea training, then the MS training. There's a whole about 2:30 till the whole day, the activity, the whole Saturday this activity is going on. Apart from that, as I've already said, during the COVID era, we published our work also, that how, because residents were not doing the human eye surgeries, but we picked up so many things from the COVID era, and we learned so many things, and we evolved over our simulator or wet lab training. So we became better in the COVID era. So this is how a roster is there. Every 6 semester there's a roster that who is posted in the in the wet lab on a Saturday, and there are 4 residents posted, 2 senior residents telling them, and there's a consultant who is the overall in charge of everything. And the people know that when is their activity, and they are ready and prepared that what are we going to do, because they are given these evaluation sheets. So this is such evaluation sheet for a first semester. One who is just joined, then he is told to do a CAT A and CAT B about this time, and then because he had to do a hand-eye coordination, so he started with hand-eye coordination on a microscope, on how to learn about foot switch, and he is given tasks like OGI repair, and he's the section making. So we start with every semester is different, but we know these tasks are there, and once he complete the task, he'll get the signatures from the consultant or the senior resident, whosoever the senior is available there. And similarly for the second semester, we go little up, because the CAT A and B has already been done. We expect them to finish C. Then on the goat eye, he has to make section making. So for every Saturday, the thing is ready. So now we have to do ECC there on a goat eye. Then have to move through. Once you have done 3 ECC, then phaco he has to do. Then he has to Madhu eye phaco. So the plan is ready. So this has to be done. Only then he will be moving from first semester to second semester to the eventually, where the things becomes after, because we expect that you have done a simulator training, and now you are doing more and more phaco procedures on the goat eye and on the Madhu eye. And this is how a thing which is the evaluation sheet looks like. I am supposed to see these evaluation sheets, only then I will allow the resident to move to the second semester or third semester to the human eye. Recently, because people were there were complaints that they are not reading, despite being told from where they read about. Then I invented this theory exec exam at third semester. They should know about the theory of the cataract surgery, only then they will move ahead. So they are told to so they are bound to read theory apart from the practical skills also. So once they are, after third sem, they were given the permission, they are certified, now they can move to the human eye. And this is how human eye cataract surgery roster is there. In PGI, we do not have camps, we don't have camps. Sometimes, occasionally, Lions Club is there. We used to do camp with them in the vicinity of, 30-35 kilometers. But again, they were all screening camps, and we used to bring patients. But somehow it has stopped since the COVID era. But we always have, number of in-house patients where the residents can be trained, and a proper cataract surgery roster is there. And they are told that on Monday to Saturday, and a dedicated table is there, and there are dedicated standard operative procedure which all the residents, mentor and mentee know, that how will he work up the patient, what kind of patient he will not take, what kind of patient, what he or she will do post-operatively. Like I said, there is a dedicated table for that, and it starts 8 a.m. in the morning. I mean, there's no that once the consultant finished, now buttons come. No, resident table is a resident table. Resident surgery will finish, only then that table will, if it is free, will goes to somebody. You can see a mentor is always standard by side, and mentor is supposed to is right now a junior consultant. I hats off to them. I salute them for their patience, and they are standing right there, right at the moment. And there is a OT list, and see that which surgery is to be done, which eye, and everything is noted down. And then after surgery, there's a resident cataract surgery logbook. So it is from the Oscar and ICOs. We have made our own program that this is going to be what all you're going to enter. What happened intraoperatively, how many times the mentor took over the surgery from you, and what was the complication, what was the time. We are writing down every minute thing, and these logbooks are there for since the time we have started this program. And every resident is asked to make an Excel sheet for their cases, and they are supposed to, anytime I can ask them to send me their Excel sheet. They're supposed to do their post-op refraction. They're supposed to take care of everything, so that it's not that they are doing surgery only. They should know how to take care of the post-operative care. They should know the astigmatism that they're causing and what all is happening. Like we are seeing that what are the complications, what all is happening. Like this guy had a PC rents, 4 eyes, he was asked to go back to the simulator again. This is how we take necessary steps. Mentor, if he asks to go back to the simulator again, go back to the wet lab, and he tells me that this guy needs training. This is how we go about and talk to each other, and we audit and take necessary action whenever it is required, so that no harm is done. We believe in that. I track that, because we post number of surgeries, but somehow they get canceled. So this is how the approximately 75% is the rate that every month we are able to do our surgeries. Like here, you can see that I've written 40 surgeries were posted in 1 month. So 31 surgeries were done. 4 PCRs I've written. So this is how I take care of the daily tracking of surgery and outcome, and what all is happening. This is where we take care. Once they pass out, once they go out of the place, then we have using these Google Forms also now. We want a feedback. This is actually an idea which is I've learned from my chief, that feedback is very important. There is no point beating your own drum unless until you know what your mentors. Once they pass out, I don't know who they are. I don't know which resident have sent this response, but I ask them for feedback. And this is the kind of feedback we get. You can see how many cataract surgery I have an audit there, but yes, you can see that we are moving from above 10. We are somewhere near 35 cataract surgery in 3 years. That is there. And then how do they feel about the mentors? The most of the time say that they're incredibly good. And this is again, I don't know who has given it, but this comes from them actually. And what kind of things they want, which of the opinion could you make surgically better? Of course, number of cases is the highest, 85%. Wet lab training, early training. This is what they are talking about, and they're free to tell everything. And we always ask, do you think you can independently perform? So 53% say, I'm confident, but would need more practice. I understand that, because the number of surgeries are near about between 20 to 30 in 3 years. And we are what we are going to do. I'm going to talk about it later. And we have also, audit, as we are auditing our data. So we have presented this structured program once it has been started, and it has been 2-3 years, and shared at various academic levels. And this is a paper which I am really proud of, where we have, we saw that what happens after this. There were residents who were not exposed to the simulator, because simulator came somewhere in 2019 we started, but we had residents which were not simulator trained and only wet lab trained, and there were residents who were simulator plus wet lab trained. So when we compared the intraoperative complications, we have 126 eyes, 101 eyes. We used to see that need to surgeon takeover was 18.6% before the simulator. Now the need to surgeon, the mentor takeover is nearly half in these patients. So the simulator training has also affected, has resulted in good outcome in these patients actually. And also we have the residents who are left-handed. We take special care how to train them, because you can imagine a left-handed surgeon doing a CCC kind of clockwise, and a mentor doing anti-clockwise. How will if something happens, how will they take care? So this is how our mentors are devised a method for the right eye and for the left eye. For the left eye, there's no problem. For the right eye, but the surgeon has to sit on the other side, and the mentor is right sitting on the table, so that he take care that when the this thing, there are 3 beautiful girls who are resident girls who are left-handed. We are trying our own ways to train them to use their dominant hand, not to do with the right hand. They are made to do the surgeries with the left hand. It's a beautiful experience. They really, we also are learning, and they are also, I hope they enjoy actually. Like I said, future step. I want to make this wet lab and simulator program for 1 year, for the 2 semesters. Because I want to take the numbers high. Why, I'll tell you. Also, I want to include the SICS, because it is a very good surgery. One should know, because it's an amazing surgery which is good for our kind of a country. And again, I want to make a pool of resident cataract surgery. That's other thing. because national curriculum for ophthalmology resident training has not been changed for a long time. If I have a national curriculum in my office, it says that only 10 cataract surgeries are required for the MS training. But this is the landmark article in 2018 where they said I think national curriculum is going to change. Essential for training to perform at least 50. So if I make my program for 1 year and 2 years, I give them this thing, I will cross the mark of 50. That is what my plan is, to make the wet lab training, cellular training for 1 year, and then for the human eye for 2 years. So I would like to acknowledge my HOD, Dr. Pandav, and of course the mentors. You can read their names: Manpreet, Parul, Fazal. Everybody is working very hard in making this cataract surgery training part successful. Thank you so much, everyone.
Thank you, Dr. Ramandeep. A wonderful, comprehensive presentation. Now I realize why you wanted some more time to make the presentation. Okay, see, I loved your first slide where you paid your respect to all the teachers. They are what who make us what we are. Like for me, Dr. Lalit Verma and Dr. Lalit Verma he was my guidance, AP Center, Dr. J.K. Reddy, who from Shankara, who really made me a surgeon. So your students, I'm sure your students are going to put your name on their presentations. The way that you have actually designed a structured training program. Actually, my classmates, MBBS classmates, brother's daughter, Neelima, did MCH with you. She has passed out. The feedback that you get from all these people who have undergone training in PGI is really wonderful. And regarding SICS, my chief guide, in fact, was Dr. H.K. Tiwari. So once he came to Shankara Coimbatore, when I was there, when I was doing, so we have there, we have 4 tables, 4 microscopes, and 8 tables. So you can actually watch through that glass window. And he just saw like the patients lying down, getting up in 4 minutes. So he went back and told Dr. Vajpayee, hey, you people are fooling us with your phaco. SICS seems to be much better. He saw the post-ops also. Like crystal clear corneas. You don't know where the section is. So no astigmatism, because we were the ones who actually started that temporal SICS. We at Shankara Coimbatore started the temporal SICS. So that is, and SICS definitely is a wonderful surgery, but you need to keep on practicing it. So my one question, because today morning only, Dr. Ramamurthy, who is a teacher in one of the institutions in Karnataka, he asked me, Dr. Sreeni, can you do a program on simulator training? Wherever can you give me an idea as to where all simulator training is available in India? I said Arvind and all are there, but he said he wanted specifically. So the reason why he is asking for it is, as you all know, the training for all these kids during the COVID time was pathetic. There were no cases, and as I asked, I asked Dr. Tityal also, Dr. Tushar also. See, I asked them, and I'm asking you also. Isn't the responsibility of the premium training institutions to help out the kids who are not actually there with your system? So either by training the teachers there, so that, because you see the training across India, less than 5% of the training colleges actually gives any training in surgery. So train the trainers. And see what, like I asked, I was in a session in that SARC program that Dr. Lalit did. So the Army hospital has got a simulator. So I asked them, and I've asked Dr. Namrata also, is there a way in which these kids from elsewhere Arvind gives some opportunity for that. These kids from elsewhere can actually get a feel of, I know that your hands are tied, you have your own people, PGs there. So is there a way that all you big institutions can give an opportunity for PGs outside? I know that it's not fair for me to ask you this, but this is a question that everyone has in mind. So I'm just asking you, is it possible, at least sometime in the future, that these facilities that are available in your institution can be offered to students from outside?
Yeah. Dr. Sreeni, I really enjoy the energy and the all the things you have. It's a great learning so many things from you. And regarding the question of using the simulator, as Dr. Tushar, I saw his presentation, because they have converted into a national skill surgical skill transfer this thing. So we are also working on the same platform, that one day we are able to make that, and it will be easy for us to accommodate any resident, any mentor who wants to come for the training right now. So this is possible, very much possible, and this is right now, even we don't have a such program, but we offer them whosoever, like we have a medical college here in Sector 32, and their residents were facing some problem with the cataract surgery training, and their HOD wrote to our HOD, and they are coming here every week for the simulator this thing. So everybody's MS is resident is allowed to come here, provided they come through the proper channel, through the HOD right now. So that is one way of coming. All right. So that through the HOD. Then then there is overall, PGI has something called observership. All right. So there is an observership program there. It varies from 1 month to, if I'm not wrong, to 6 months. And PGI charges some money for the observership, and he or she applies for the observership in that department, and he or she is allowed to work as an observer in that department, and that need not be you not be in a government servant, or anybody can come for the observership in PGI. And once you come as an observer, then we have a program for them, that what all can be given to that person. And definitely we have had observers in the past also, and they have been exposed to simulator also. But yes, it is already being done, and more can be done about it.
Yeah, wonderful. Nice to know about that. And one more query, like, see, I for my state conferences and my CMEs that I do, I make them arrange facilities for the wet lab, FACO. So what we use is that artificial eye. You get so how do you compare that with the God's eye? See, the goat eye is always better eye. That's always better. All right, this is what I feel, because I told you the nucleus can be hardened with the heat or a formalin people, but the artificial eye, the Madhu eye, will come with a known set of hardness there. Plus, it's the CCC is, in a goat eye also is very leathery. It's not a human feel, but in a Madhu eye, or sorry, in the artificial eye, it is more leathery, more difficult actually. So I always feel that yes, the artificial eye, the Madhu eye, is less messy, but the goat eye is more messy, because there is a fluid going on around there. Because I have in mind, I have to design a table where the fluid will go to the sink. Right now, I don't have that table, but I have it in mind that how I'll make a steel table so that there is no the water spillage over to the surgeon. So if you ask me, the goat eye is always number one, but the artificial eye is number two. Yeah, great, Ramandeep. But like, I love your passion. I envy all you teachers. I've never been able to. I'm basically a surgeon. I do. I've never been able to. I mean, that's my biggest regret. And I love you teachers. And it was a wonderful presentation. And I'm sure that people are going to see this again. And classy presentation. thanks a lot, and a lot to learn from you. See the way you presented, the way you prepared for it, absolutely wonderful. Thanks a lot for being part of this program.
Thank you, Dr. Sreeni. Thank you so much. Thank you.
Thank you, thank you. So now, see these PGI and Lions and all are big institutions. So I for this program, see it's not that everyone can, because there is a limit to what these big institutions can accommodate, the number of trainees that they can take in. So there are smaller institutions which are doing really wonderful service in training. A lot of see, like it's not just the PGs. See, like somebody who is into practice and has developed a practice, probably is doing some SICS and wants to upgrade to FACO. And so what to do? Like they can go for only short-term fellowships, and if they go for short-term fellowships, it has to be really like the time that they spend should be really fruitful. So they should actually learn cataract surgery, and should be able to come back and do cataract surgery. And Nandadeep Eye Hospital is see, I've been following Dr. Sourabh Patwardhan through all the programs, WhatsApp, YouTube, and everywhere. He's a wonderful surgeon. A lot of innovations in surgery that he has done, and he's a head FACO training and fellowship program, and chief mentor FACO tips 3D training course, which is the first of its kind in the world. At Nandadeep, and he's a pioneer in live streaming of surgeries on YouTube and Facebook for education. More than 12 publications and more than 30 chapters in various books. And he's got some wonderful innovations. iToric, Patwardhan, Android phone-based toric marking, which is extremely useful. The hybrid chopper, 3D viewing system, and runs popular FACO YouTube training programs. And he is another person who has a passion for teaching, and a lot of these youngsters and not so youngsters have been really trained by Dr. Sourabh. And Dr. Sourabh, can you please start your presentation?
Yeah, hi, Dr. Sreeni, and thank you so much for those kind words. And Dr. Sreeni is my senior from RPC. So I think we all share the same passion of teaching to others, I think, from RPC. So I will briefly present. So here we start. Okay. 1 second, I think I didn't share the sound. Okay, is it visible, Dr. Sreeni?
It is visible. It is visible.
Yeah.
You
Okay.
can make it full screen.
I will do it full screen. There I go. Okay. So basically, I'm a director of Nandadeep Eye Hospital, and I will just show where it is located. So we have multiple branches now, but the training takes place in this place, which is called Sangli. This is in the southern western part of Maharashtra, which is our chief training center, which we have. Now, I will be dividing this lecture into 3 parts. First part will be what is the philosophy of teaching, like what philosophy that I follow. The second will be the infrastructure that we have for teaching, and then the available options and which one you should choose. So some of the advices that I would like to give to the students. So training is about training the surgical hands and feet. So the training involves a lot of motivation. So it's not only about teaching surgery, because I feel that it's not just the surgical hands or skills that the surgeon has to learn. He has to also have a lot of motivation, has to have a goal in life, and also need psychological support during the training period as well as after the training is over. So you can see that is, one of the photos one of my actually trainees clicked, and you can see, look at my eyes, that is how what happens when, just a moment, I think the timer is on, so I will just remove that time. Okay. So now when we are teaching someone, it's like passive driving, you are more tense than the trainee sometimes, because you are always anticipating that, something wrong might happen. So look at those eyes, just glaring at the video screen that something bad is going to happen. And but that's how it goes. So that's why very few people are really good at, teaching, have the patience of teaching, because they're afraid. They would rather do the surgery themselves rather than, have that patience to teach someone else and then manage the complication. Now, see, we have to look at these 4 levels of competence, and whenever any trainee reaches us, we should know where exactly he is, standing. So the first level is of unconscious incompetence, where, the trainees are not aware also what they lack. So for these trainees, I think it's best if they do some homework. Somebody is, I think, talking, can be muted.
Dr. Ramandeep.
Okay. Okay, so the first part where we understand that this trainee doesn't know exactly what he's supposed to do. So what I do generally ask the trainees to view my YouTube channel, because I think for us it is the best source of knowledge to go stepwise, see all the YouTube online surgical videos, not just for my channel, but there are very, very good teaching channels all around. And then once he comes, I think if they don't have any experience of working under the microscope, then they should undergo wet lab training. And we also have a 3D teaching course, which we show to every trainee when they come. So they understand what they are supposed to do. The second level of competence is conscious incompetence. That means once they start doing the surgeries, they realize that these are the things they are, lacking, and they need to work on that. So again, now they have to go back to the video libraries. They have to watch the 3D videos which we have created, and they have to analyze. They have to speak with the trainers who are there or consultants and understand what they are supposed to do. And then the third level is conscious competence, where, see, after few surgeries, when they realize that they can do the surgeries, and now they are becoming more and more proficient, so they can work on each and every step, how they can make it better. And that is where the hands-on training is really useful for them after the initial steps are over. And once they have done that, they have to go to the next level, which they can do once they are in practice, where they have to do more and more surgeries. Also here, the repetition is key. You have to keep on watching a lot of YouTube channels still. Keep visiting good experienced surgeons. So that is how you improve. Okay, so what is the eligibility? Because many times I get this thing, applications like we haven't done any surgery for that matter, and this is the truth. Even like few good institutes are there which give really good hands-on training during their post-graduation. I think most of the institutes do not have any hands-on training or very minimal hands-on training. So what is the eligibility to do a good cataract surgery? It's simply that you need not be completely ambidextrous, but you should be able to use both your hands. And you should have a good stereopsis, because we had sometimes issues where surgeons had trouble in working on the microscope, and when we realized that, because they were really struggling as compared to others, and we realized that they have really low stereopsis, and they might be having sometimes muscle imbalance which can be treated. So I think that is one thing we have to look at, that they should have a good stereopsis before they start training. And they should be physically, as good as Arnold. That's just joking. So really the strength doesn't lie in your physique, but the strength, what is important is to have a good muscle strength in your fingers. But nowadays what I have realized, that nowadays we are quite used to the smartphones and gadgets. So earlier, maybe 15 years back, we had sometimes these issues where we are not using our fingers that properly, but nowadays that issue is really less, because we are now so used to various gadgets, and of course we can train them if somebody has issues. you have to train your non-dominant hand. So I think this is something which I always tell whenever the trainee starts getting these issues in the initial phases, ask them to write paragraphs with their non-dominant hand, start brushing teeth, etc. And that really helps, because then you find yourself using your left hand or the non-dominant hand more and more, and this is really important. Now, 2-3 years back, me and Dr. Deepak, we started a common platform for the youngsters, which is called facotraining.org.in. And when I designed logo for it, what you can see is there is an eye and there is a brain inside that eye. Because I really feel that we both share this idea that we don't really train our hands or feet, we train our mind. So it is the mind which does the surgery. So if your mind is analytical and can understand the patterns, then you can train that surgeon very, very quickly. So training in any surgery for that matter is like learning bicycle. You start with some hand holding. You need to really, hold the surgeon's hand, trainee's hand, and ask them to learn. So they cannot do entire surgery right from the first go. So if any trainee has that in, their concept that right from the first surgery, I should be doing all the steps, they are going to have bad time. So they should go stepwise. There will be some falls, and that fall should give rise to more analytical and skill development. That is very important. And as they learn, they are then going to the real life scenarios where they might be practicing on their own. So how does this, translate to cataract surgery training? So initially they need to do a lot of wet lab or simulators, as some places it's available. And then they should start with steps. So it's always what I have seen, like we are training for last almost 10 years now, and I have developed this stepwise program for the beginners, and it's also called reverse training, where we start something like starting from incision, and then we give them the cortex aspiration part. Once they learn that, then we go to the nucleus training part, and which really helps to build a confidence. Many times they feel that I should get all the steps in the right first case, but what happens is that they start getting a lot of complication, and when a trainee gets a complication, they become more hesitant, and that prolongs their learning curve even more. So it's always best to go stepwise, and that is in the best interest of the trainees. And it's always important to learn from your mistake, not just your mistake, but there are so we really enjoy training, because many times we have 4 to 6 trainees at a time, and from different regions, also from outside India. And what happens is that when we have more trainees and they are doing their surgeries, they have different difficulties, and they can discuss those together. They can see the other trainees getting trained, and that I feel is very important. That gives rise to more exposure to, because most of the trainees are at the same stage. So many times the efficient or the experienced surgeon may not be getting those problems, but the trainings in the similar experience, they get similar problems, so they can discuss those even better, and then they learn very quickly. And then, as I said, after first few surgeries, many times the trainer doesn't have to even wash for the surgery, because the trainee can now do independently. And in the later part, you can see the trainer is not even in the picture, because now the trainee can do the surgeries quite independently later. So you have to divide the steps into 2 parts. So the steps which require just hand-eye coordination, and then steps requiring leg and eye coordination. And when you have to combine both these together, those are the difficult steps. That's why the primary chop is not something which you can learn very easily right at the first time, but what you can learn trench divide much easily, because you just need hand-eye coordination. You don't need a leg-eye coordination at that time. So we develop the steps according to what coordination is required, and then we do it. So we already have set up for wet lab, which is again set on Kitaro. And apart from Kitaro, we sometimes use Desai. We earlier used to use that, but I feel that in wet lab training, basically what you need to learn is more about hand-eye coordination and leg-eye coordination, rather than doing the surgery itself, to understand how the microscope works. So that is called psychomotor training. I will not go through the entire video where I have shown how we train on the wet lab, but let me just understanding different hand movements for. So these are different hand movements that we ask the trainees to practice on wet lab, and this is usually only for those trainees who had no experience of phaco or any cataract surgery before, but otherwise they can start with the surgeries. So various different steps are taught. Then they are also taught about adjusting microscope. This is something which to begin with, we tell them to adjust themselves in the OT. First couple of cases they need to get accustomed with the OT environment, different microscope, and then we start off with the wet lab, and then slowly go on to the complete hands-on training. So now coming back to the infrastructure that we have for our hospital. So this is the hospital where we are training the doctors. So out of these centers, as I said, the Sangli is the center where we are training. So what is the USP of our training programs? I think the first thing is the passionate teachers. Both me, my wife, Dr. Nidhi, we are all love to teach our training, and we have a very good team of other consultants who are also, they like to teach. Our very structured course, so every surgeon who is coming to us, they know what is expected from them and how they are going to learn here. Infrastructure and equipment are available. Whatever we have purchased are keeping in training and teaching in focus. So, and there is abundant hands-on experience at our center. So I will just show some of the infrastructure that we have. So I personally feel that if you want to train someone, you should have the best of the machines. So if you once you have learned the surgery, you can operate on any machine for that matter. But if you are learning, I think you should have a machine which is very, very, you can dependable machine. So always we have invested in good machines. So we have most of the Alcons machines, which are high end, and we also have earthly machine for those who want to practice on earthly. The microscopes are extremely important. So we see to it that each and every microscope that we have has a stereo coaxial illumination. So either we have Leica M822 or Zeiss Lumera I, which has inbuilt stereo coaxial illumination, or we have higher end Visu 200 and other microscopes which are upgraded to stereo coaxial illumination by using the devices. Because I feel that if you see well during the surgery and you are very comfortable, then your learning curve is going to be shorter. So good stereopsis, good red glow is very, very important for learning quickly. So we also have unique 3D teaching experience. Nowadays, in fact, I push my trainees to work on the 3D microscope that we have, and we ask them to perform on that because it's very useful for trainee as well as for the trainers, because they can exactly see what the surgeon is doing. And we make sure that after few cases, they shift to the 3D so that we exactly know at what level they are doing the phacoemulsification, because many times in 2D we miss that, and the surgeon doesn't learn how to do the surgery at the iris level. So that's me teaching one of my trainee in the difficult cases. So we have different training programs for basic as well as for difficult cases, like here he is doing intumescent cataract on the 3D microscope. This is the iris claw implantation which is being taught to our trainee. There will be always one-to-one supervision where one of the experienced consultant or my colleague will be there with the surgeon all throughout the surgery, where each and every part of the step is informed. We are very particular about the hand position that the trainee is using. Many times what we see is on the screen, but what they are having difficulty is in something which is not seen on the screen, which is the hand positions and hand. And we have seen that their improvement is marked after we correct their hand positions. So even these 3D surgeries are recorded, and then we can analyze and see these videos in the 3D. So we have multi-dimensional approach to the process of learning, starting from live 3D. So whenever I am operating, when I have my private list, I operate on the 3D microscope. So all my trainees and fellows can watch the surgery exactly how I am doing. And we also have video analysis sessions where we see the surgeon's complications. So once in a week or once in 2 weeks, we have these sessions. We always, of course, discuss the surgical complication then and then again. and surgeons can also go back to wet lab training whenever needed. So once a year, we also take this Phaco Tips 3D teaching course, which was very popular. So now we'll be taking the third course this year. So these are all surgeries which are live in 3D, and the meaning, it is meant for teaching. So every every step is properly shown to the audience, shown to the trainees, and it is analyzed during the course. We also, it is completely a video assisted or assisted course, where all other surgeries are also shown in edited form in 3D. So this is an excellent course for all the beginners as well as experienced surgeons to understand. Now, this is something for those who are completing their post-graduation, and these are my advices, whether they should go for long-term or short-term, or they should go for a job. So if in your post-graduation, you had very good clinical or academic experience, that means you can run your OPD independently, then, and you want to learn cataract, then there is no point in going for long-term fellowship. Then you go for a short-term fellowship. But if in your PG, if you didn't have good clinical as well as academic experience, that means you are not confident to sit in the OPD and advise to patients, then it is better to go into a long-term fellowship program where you can learn the academics, you can have the ability to run the OPD after the program is over. Otherwise, go for a short-term training program. So it's good if you have got good clinical academic experience in PG. Also, you should have enough funds, that is financial backup. Sometimes we, in fact, in our part, like the PGs have to complete their bond. So before going for the bond service, they want to do a short-term cataract procedure so that during the bond service, they can operate with confidence. Also, they have short time in hand. Also, it is short-term training is very useful for already practicing surgeons so that they can upgrade their skills. If there is lack of financial backup, then you can choose maybe a medical officer post or job where you can also get some training. Okay. So academic program at our center, which involves weekly 2 to 3 lectures, symposia, as well as case presentation. We also have DNB courses and FCPS post-graduation courses. So they are there, which really add to the academic discussions. Can somebody mute this? Okay. Then all the surgeries are supervised. We have different specialties. So the whoever is the fellow, he has exposure to all the specialties, either surgical or medical. And they also get the experience of handling peripheral OPD independently. So these are the teaching programs that we have. In the long-term program, which is 18 months, we have anterior segment, Phaco or SICS, and SICS, where they approximately get 150 to 250 surgeries. Our main focus is on Phaco. So most of the surgeries are Phaco after initial SICS. Also including complex surgeries and complication management also they learn during the long term. Then we also have 18 to 14 months of anterior segment plus cornea or glaucoma. And we have 30 to 36 months of cataract plus surgical retina program. And we have also started recently a 6 months short fellowship program, where it's a paid program, because if somebody doesn't want to do 18 months program, but still they want to do more number of surgeries and learn, they can do this paid courses where in 6 months they can do 100 surgeries, including the complex cases. Now, the short-term courses are of course paid, and they are 1 to 2 months, but the duration can be customized. Generally, for trainees, we are able to give 10 to 25 cases per week, depending on how it is planned. And we also have customized advanced course. So for those surgeons who are doing their basic surgeries, but maybe they are having difficulties in doing complex surgeries, they can opt for the customized advanced course where they can do complex cases. They can learn iris fixated IOLs, do CTR, iris hooks, BHEX use, or they can do anti-vitrectomy. We also are associated with Alcon for the Alcon Phaco development program. So Alcon, if you are using Alcon machine or you have recently purchased, you can also opt to come to us through the Alcon Phaco development program. So these are the different programs which are available with us. Of course, the online YouTube teaching channel is always there. There are a lot of playlists there for you to watch. We also have the phacotips.org.in Facebook page, where we keep posting live surgeries as well as many teaching videos. Both me and Dr. Deepak post it. I also have this handbook of phaco training, where all these YouTube videos are compiled together with text. So it's like a textbook primer. So I send it to my all trainees, so they have to read all those and see all the videos which are there in the book. It's around 100-page book, but it's very useful for learning in a structured manner. So those who want to apply for these courses, they can mail me on this email address, and or they can WhatsApp to my admin's number. So if you believe in yourself, I think anything is possible. So anyone who wants to learn, they should just find the right mentor and right center, and they will be able to learn the surgery. That's all from me, Dr. Sreeni. Thank you so much for this opportunity.
Thank you, Dr. Sourabh. See, great work that you're doing. You should really understand that we from Aapti Center are really proud of you. It's like, for example, just that cube pull technique for Rex's runoff. So wonderful. It really works. It really works. And see, all those programs that you're doing. And see, you have hit upon some very important facts. The passion that a student should have for learning or whatever surgery, that is the most important part. The other one, when I was discussing with Dr. Deepak Meghur when he was presenting, he really agreed that, see, much more important than your hand skill is training your mind. Like, you should really want to do it, and you should know what to do and what not to do. And if you're really confident and you really want to do it, you'll be able to do it. So it's mostly in the mind, and see, hand comes secondary. I mean, and definitely the hand, eye, foot coordination. So all those things. So see, I mean, personally for me, I don't think I'm a born surgeon, but I keep telling people, see, I do regularly about 50 phacos in a day and 800 900 phacos in a month. It's basically it's my mind that is working. And one more thing that I would tell all those kids who want to learn and who are going to become wonderful surgeons in the future. See, initially in their early stages of the career, it is the ignorance that causes complications. Later on, it's your complacence and your arrogance that causes complications. So finally, everything comes on to the mind. And Dr. Arulmay Varman, see, he had a paper. He showed a paper during his presentation. He says that the learning curve, the kids learn much faster when they are getting trained on 3D surgeries when compared to the normal microscope. That's one observation that he had. And another important one, maybe that's something that you can also follow. See, he says he has a program which runs a year long. Like, so they come for those who are in practice. They come for a week and get trained. Then they go back. In between, they can come. So it's an ongoing process. It's not a continuous one for 1.5 months. So that might be much more helpful for. It's his practice. It need not be. It's just something that I found to be quite, because I recently, one of the juniors just called me. These people keep on calling me. So what to do, where to do? I have this much of practice, I can't leave. I said maybe you should consider Uma and Dr. Arulmay Varma, because he has this sort of a program. And see, and one more thing that I wanted to know from you is see, how much is the fees for that 6-month course that you have, and how much is the fees for that your very short course, 1 month, 1.5 month training program?
So regarding the short course, I think we can customize the course for the the practicing surgeons, and we can finish the training in 2 weeks time. It really, see, my experience with the already practicing surgeon is that they should be ready to learn. That is the basic thing. So because if somebody is practicing and doing surgeries, it's important to unlearn some, steps which they have learned wrongly during their, that's why they are having trouble in, upgrading their surgery. That is the first thing. So if they are ready to unlearn and learn the steps properly, then they can learn everything in 2 weeks time. So that's more than enough. They can do around 25 to 35 cases in those 2 weeks and then just finish off. I have trained few surgeons who are in practice for 20 years and were still doing primarily SICS and few FACOs, and they were with me for 3-4 weeks, and now they are doing like 5 to 10 cases every day. So it's basically like, if you are really into the surgery, you are learning, even when you are not doing, you are attending conferences, seeing videos and learning, then you can learn very quickly. As far as the fees is concerned, that generally our charges for FACO for short-term training is around 6,000 rupees per case. It also varies from a number of cases that they are going to opt for. And the 6-month course fee is 4 lakh rupees for the trainees who want to learn quickly and do more cases in that 6 months course. It's like a compressed fellowship program, because they are exposed to all the specialties also during this comprehensive like the 6-month course, and at the same time they get more number of surgeons.
Wonderful work, Dr. Sourabh. Thanks a lot for taking your time off for us, and it's great to see you growing. I know that the number of branches are growing. Like last week, I was with Piyush in Calcutta. Is telling Sourabh, he is somebody else. so great. Like everyone is appreciating your work. Great job. Keep doing great.
Thank you, sir. Thank you, sir, for the opportunity. Thank you, sir.
Thank you. So now we all have the privilege of listening to what are the training programs available in a hospital which has been started by a legend in ophthalmology, Dr. Vikas Mahatme, Padma Shri, Dr. Vikas Mahatme, and he founded the Mahatme Eye Hospital, Nagpur, which is a recognized postgraduate training institution run by SMM Eye Welfare Charitable Trust. It started in a small way, and it now treats 55% of the patients free of cost, and it's so far performed 160,000 eye operations, of which 55,000 operations have been done free of cost. And Sir must be the only doctor to run eye hospitals in several places in Maharashtra, and Sir himself has performed over 80,000 eye surgeries and been invited to demonstrate surgical techniques in various countries across the world. And he's a recipient of Colonel Rangajari National Award, and his institution offers, the Mahatme Eye Institute offers postgraduate courses in ophthalmology, DNB, idiomas, paramedical training, and everything. And he is the first to demonstrate live surgery. It's a recognition training center where over 500 Indian ophthalmologists and more than 500 eye surgeons from abroad have been trained till now. And so this is I thank Dr. Rutuja Gawande, who's going to who's agreed to present on the training program in Mahatme. She's a consultant there, and she has been there from 2022, and she did PG from Mumbai, KM Hospital Mumbai, and secondary DNB from Mahatme Hospital. And so this is basically what I wanted to see also. See, people who are trained in that institution continuing there as consultants and growing with that institution. And that's it. It would be great to hear from you, Dr. Rutuja, about the training program in Mahatme. Over to you.
Thank you, sir. Good evening, everyone. I'm Dr. Rutuja Gawande, working as a consultant at Mahatme Eye Hospital. Thanks to Dr. Sreeni sir and KSOS for giving us this opportunity for representing our institute in fellowship program. And nowadays, everyone is searching for fellowship, and so this videos and this what you have initiated this topic will be really helpful for postgraduate students. Now I'll be sharing my. This is our hospital situated at Nagpur. We have multiple branches.
Dr. Rutuja, you can make it full screen.
It's full screen. Shared it.
Share.
I can't hear.
That's okay, Rutuja. And it's okay. It's okay. You can. I mean, it would be nice to see it on full screen. Go down there and.
Is
No,
it
no,
okay?
No. It's not full screen, but you can go to the slide number 2 and start presenting. Go to slide number 2.
Is it visible, sir?
Yeah, it is visible. It is visible. It's not.
Okay.
It's just
I don't know. It's not getting full screen. I don't know.
No, that's okay. That's okay. That's okay. We can see what is there. You can continue your presentation.
Okay, sir. Okay. So we have other hospitals at in Nagpur itself, and other at Amravati, and one is in the Mumbai. So Mahatme Eye Bank and a hospital provides SICS and FACO teaching program to fellows for various durations. One can mail their CV at manager@mahatmehospital.com. We have different fellowship programs, including 15 days of SICS and FACO, 2 months of SICS and FACO, which is run by the Government of India, and 3 months of SICS and FACO fellowship of ICO fellowship, which the person who have cleared their fellowship in International Council of Ophthalmology. We have a 18 months comprehensive cataract fellowship and 24 months comprehensive plus subspecialty fellowship, which includes glaucoma, medical retina and cornea. And we give them all the surgeries, including trabeculectomy, all other surgeries of glaucoma, and medical retina also lasers, and in cornea all penetrating keratoplasty of including therapeutic and optical, and also the corneal tattooing, which has been invented by Dr. Mahatme sir. We have a paid fellowship, which the cases are given according to the person who is taking the fellowship. 30 in general, 30 SICS and 30 FACOs. In long-term fellowship, they get 400 to 500 SICS and more than 100 FACOs. Apart from teaching, we provide them food, accommodation, and transport facilities. We have DNB also, which is recognized by NBE. We have primary and secondary DNB also. In initial 3 months, we teach them the wet lab training, which is continued till last year of their residency. During first and second year, we teach them the investigation, the refraction, all the academic is done from all 6 days, and posting in various subspecialty and surgery under guidance is done. During the last year, they are able to do independent surgery around 250 to 300 SICS and around 50 to 70 FACO, which can be increased if they are doing well. And the secondary DNB, they have the initial wet lab training and all the investigations, refraction and academics in first year, and OPD exposure also. And they are also given the independent surgery of 300 to 350 SICS and 50 to 100 FACO. Fellows are first trained on goat's eye in wet lab, and then wet lab contains many goat's eye, and fellows can practice for any duration and can use any number of goat's eyes. We have a trained person in wet lab who teaches first theory and then make fellows practice on goat's eye by explaining each and every step. Wet lab training is compulsory before operating on human eye. We start with SICS teaching followed by FACO teaching. This is our wet lab, where the wet lab trained person is teaching the training, the theory, and then this is the surgery is being done in wet lab. In wet lab training for SICS, as we have fellows which those who have not done any cases or few cases, so it is very important to have orientation of microscope and also the instrument handling. And in wet lab, we teach them the various ways of and types of making tunnel with advantages and disadvantages of each, and different methods of rhexis, and also the nucleus prolapse and delivery, and also the different types of sutures technique like continuous, interrupted, matrix. Then in wet lab training for phacoemulsification, in addition to the orientation of microscope, we teach them the phaco machine parts, the phaco machine parameter, which are used in, which are different in hard cataract and soft cataract, and techniques of phacoemulsification like stop and chop and divide and conquer and direct chop, and various ways of each steps with advantages and disadvantages of each. Steps focused in wet lab training, including SICS and phaco, the incision and tunnel, rhexis, and especially the holding of probing, phacoemulsification. The foot pedal control, which require, in phaco we need both foot and both hands, and so we teach them the foot pedal control, dealing with the nucleus. In wet lab, what we do, we implant a new human nucleus, which is derived from the small incision cataract surgery, and then we make a tunnel in goat's eye, and then we implant that human nucleus in the goat's eye, so that they have a feeling of doing cataract surgery in that way, in that goat's eye, because the goat's eye nucleus is very soft, so it is difficult to learn direct chop in that goat's eye, and also dealing with the chopper and suturing technique. This is a short video of wet lab video.
Rutuja,
Yes,
actually, your slides are not moving. I didn't stop you because the slides were not important. What you can do is you can go to that slides that arrange the slides and go there and click on it. Then welcome. You can click the video now.
okay. Is it okay?
Yeah.
Now we implant the goat's eye in the face, and then all this, as being an ophthalmologist, we all know the steps, but I'm just briefing it out here. This is how we taught. We do it with the cystitome, and then here we do the nucleus prolapse with only the single Sinski hook, and then nucleus delivery is done by the visco expression. And secondly, this is the phaco. We teach them both the stop and chop and the direct chop technique. And this, you can see the human nucleus is being implanted here, so that they can learn the direct chop. Now, proper pre-operative evaluation of cataract patient is being done, including the slit lamp examination, blood workup, and pre-anesthetic checkup. We divide the patients into 3 categories, which include the category A includes no additional risk factors. Category B includes 1 point each, previously vitrectomized eye, corneal scarring, small pupil, shallow anterior chamber, age more than 88 years, patients with high ametropia, posterior polar cataract, and other conditions like poor position of eye and patients. And the category C includes the white or brunescent cataract, pseudoexfoliation, phacodonesis. So we divide patients into 4 categories with a no risk, low risk, moderate risk, and high risk. And patients belonging to no risk and low risk group are allotted to fellows. And high risk patients are being done by the consultant. In the OT, fellows operate under consultant supervision. Cases are displayed on the screen. Steps of surgery are also further divided as a low risk and high risk steps. Fellows are allowed to do low risk steps, and very high risk steps are done by the consultant. So I'm just briefing the manual small incision cataract surgery, which are the low risk steps like the superior rectus sutures, conjunctival flap, cauterization, side port. All these are the low risk steps which are being done by the trainees. And other steps are also done by the trainees, but they are under the meticulous supervision. Like the tunnel is being the high risk step is done under supervision. And nucleus prolapse is done under supervision. Delivery is done by the trainee. And same the irrigation aspiration, as the Dr. Sourabh Patwardhan said, that we give a stepwise approach to the patient, to fellows. Like we don't give initial stages irrigation and aspiration. We teach them, we allow them to do the whole surgery, but irrigation and aspiration has a more complication rate, so it is being done after they do the full surgery. This is a consultant teaching the trainee with the case being displayed on the screen. And also with the phacoemulsification, as we all know, the incision is the foremost important part in phacoemulsification. So it is meticulously
Rutuja, see, I mean, what you can do is, because actually this is not, you can change your slides on that side. Okay.
Okay. And the irrigation and aspiration is done by the supervisor. We have a well-equipped OT with vitreoretinal backup, and vitreoretinal surgeons are also available all the time if any complication occurs. So we grade the fellows according to ICO Oscar score. This is the score for SICS, and we have for FACO also. Surgery performed by the fellow is graded according to the ICO Oscar scoring system, and stepwise feedback is taken. Lacunae or problem areas in the surgery are also identified, and fellows are asked to practice those steps in the wet lab. Next day, fellow examine their operated cases along with the consultant, and if any complication occurs, adverse event form is filled and management is done. All the records are maintained properly, and consultant guide the fellows regarding the improvement of surgeries after surgical review. These are the preoperative and postoperative patients. This is our, we have a register. Our PGs and fellows maintain the register, which includes how many cases done in every OT and how many complications, what are the teaching. Then this is the surgical review form, which is this surgical review occurs after every 3 weeks, and where we have this form has a data of SICS and FACO the fellows have done. This has also the average self grading, the visual outcome of 660 or worse, 6/18 or better, and also the complication and average time of the surgery, so that they can assess themselves. If any complication occurs, then fellows or resident have to fill adverse event form for each complication, and logbook is also maintained. Apart from the teaching, we teach them the various investigative procedures. What we have here, the specular microscope, pentacam, OCT, and B-scan also. We also organize the various guest lectures from national and international faculties to acknowledge our trainee with recent advances, as well as to help them to improve their surgical skill. Our medical director, Padma Shri Dr. Vikas Mahatme sir, despite of his busy schedule, manages to teach and interact with the trainees and motivate them to master the surgery as well as academics. Recently, we had an international faculty, Dr. Faiz Khan, along with Dr. Mahatme, teaching trainee in the wet lab. In this way, fellows are taught each and every step of surgery under supervision. Trainees are told what to do as well as what not to do in the surgery, which is more important. And we have a less complication rate. Wet lab training, video assisted surgery, Oscar grading, and consultant supervision being key to this. So we try to master the fellows not only in cataract surgery, but also to become a better ophthalmologist in diagnosing and treating patients. Thank you.
Thank you, Dr. Rutuja. Wonderful presentation. You can unshare now. So how many long-term fellowship training programs do you have?
So we have we can divide it into two. We have 18 months cataract.
You can unshare first.
Okay.
So you'll come full screen there.
Yes.
Yeah. Okay.
Sorry.
Yeah.
We have, sir, 18 months fellowship, exclusively cataract fellowship, and the other we have 24 months in which we have a cataract, including cataract, we have glaucoma, medical retina, and cornea.
Okay, and so do you people who undergo fellowship go for camps and?
Yes, sir. Almost every other day we have a camp. We covered almost all Vidarbha region near Nagpur, and we have other
weekday camps or weekend camps.
Weekday camp, but no night stay.
Oh no night stay.
No night stay. Yes.
Yeah. Okay. And so, do you have you must be having an alumni of whoever has got trained for there. Do you have a support system for them? Like those who have got trained from there wants to learn something further or wants to refine. I think like maybe 10 years earlier.
Short term, you meant
Yeah.
short term?
Do you have any program that helps the fellows who
Yes,
are short term there?
we have a paid fellowship for that. It's a short duration, 2 weeks
Okay.
fellowship.
Okay. Again, and again, like I'm not sure if your management would let you answer that. But since you're a girl and you've gone through all these programs, so would you? Does your hospital have any leniency for girls, like when compared to boys who do this thing? Or see, most of the hospitals. Like I asked the consultant from Shri Ganaekal Nethralaya, so she said, no, the gender equality is there here also. So, but this is a question that all the girls have. So
Yes,
I'm just asking you. So
in special cases, we give them leave.
Okay.
If they are facing problem, then we give them leave.
Okay. That's nice to know, and convey our regards to Mahatme sir and madam, and thanks a lot for presenting. And like see now actually like the kids in my state would know, like, see what are the training opportunities available in your place. But otherwise we just concentrate on the south and all. See, I just wanted to give them an opportunity to know what is available across India. And thanks a lot for joining us program. Thank you. Thanks a lot. And now we'll move on to another great personality in Indian ophthalmology, whom all ophthalmologists in India know, Dr. Mohan Rajan. He's such a jovial fellow and shows such wonderful surgeries. And see, he has actually. If you are a fan of OPL, so he has won the maximum number of OPLs. But I bet him once in Telangana conference. So this is that is on a lighter end. And Rajan Eye Care Hospital is a recognized super specialty eye hospital and postgraduate Institute of Ophthalmology, affiliated to the National Board for 27 years. And it's got different training programs like DNB, short-term fellowship in microsurgery, phacoemulsification training programs, fellowship in optometry and ophthalmic nursing courses. So it does a lot of continuing medical education programs, live surgical skill training programs, a lot of programs. And in addition to that, it's a lot of it does a lot of innovative and really useful for the public programs like Blind Free India program, Netravahana, the Mobile Eye Clinic, the Slum Vision Project, the Tribal Vision Project. It's a huge lot of programs. And the eye bank in Rajan Eye Care is supported the Rotary Rajan Eye Bank, which is a project of a Rotary Club of Madras, T Nagar, and it's really supported by the legendary Vijay Amritraj. Like we always used to love him to see him play in the Davis Cup, and so this is the kind of following that Rotary Eye Hospital has. And sadly, Dr. Mohan Rajan, I called him up a few days back. He had undergone multiple surgeries, so he had so still he's somehow managed to work, but it's too much for me to ask him to be here personally to present the program in his hospital. But he was kind enough to Lord Dr. Rajguru, and he said, Mohan Rajan sir said he is the best. When Mohan Rajan sir says he's the best, and he is the best. And so he is a wonderful trainer, and he has trained a huge lot of surgeons in Rajan Eye Care, and personally he has done more than 1 lakh eye surgeries, cataract surgeries, and done more than 5,000 glaucoma surgeries and oculoplasty surgeries. So he's got more than 20 years experience, and definitely, as Mohan Rajan sir said, so he is a person whom we can look forward to have a wonderful presentation on cataract surgery training program in Rajan Eye Care. Dr. Rajguru, can you please start your presentation?
Yeah, thank you, Dr. Sreeni, sir. Thank you for your kind words on Rajan Eye Care and the program. I'll be screen sharing now. Can you see, sir?
No, it's not shared. Dr. Rajguru, what you can do is first you open your presentation. Yeah, it is there. Please make it full screen.
Yes, sir. Is it full screen,
sir?
Yeah.
Done. Wonderful. Yeah. Perfect. Please start.
I am myself Dr. Rajguru from Rajan Eye Care, where I train all the fellows and budding ophthalmologists, DND postgraduates in cataract as well as SICS. Ours is a tertiary eye care institution in Chennai. It has got 3 centers within Chennai, one in Adyar and another one in Velashiri, apart from the main center at T Nagar. There are around 25 consultant ophthalmologists and 150 allied staffs in our hospital. We do around 15,000 cases a year. And we got latest cutting edge technology with Femto and Smile LASIK all in our main center, and the peripheral centers, they have cutting edge phaco machines, and we do cataracts. The rest refer to our main center. We are offering this cataract program since 1996. Almost 25-27 years since then, we have been offering this programs to all those practicing ophthalmologists from India, and we had the privilege to train people from other countries, the Middle East, US, as well as Southeast Asian nations. And main thing is our programs are very flexible. Regarding the duration, regarding what basically the person wants to learn, and we train them in all the difficult steps. In that way, we are very flexible with the programs. Second is we offer state-of-the-art machines to all the fellows. It's not that they'll be given a phaco from starting with a low-end machine and all that. It's nothing like that. We offer state-of-the-art machines so that their learning curve as well as the learning duration, everything will be very much shortened. Then the coaching is completely guided. I guide personally all the fellows in both starting with the basics to the latest direct chop or any other cutting edge thing, with complication management also. Then we analyze post-ops of every case through video recording. We don't just write in theory, but we record all our cases, and we analyze it stepwise on the videos. And this is our team, our chairman, Dr. Mohan Rajan, and our executive medical director, Dr. Sujata Mohan, and myself. And as I told you, the programs are very flexible, and you can always expect a personalized training. Flexible in all duration and number of cases and what step they want, everything. And some of the fixed tenure programs we have is for 2 weeks, 4 weeks, both are only for PECO, and 6 months and 1 year fellowship programs where we teach both SACS as well as PECO. For the short-term programs, we charge the fellows, and for long-term programs, we pay them a stipend. And we have orientation classes and post-op video review classes. For long-term fellows, we have weekly classes. And they'll have ample exposure, even if it's a short term. In long term, they will surely have very good exposure. In long-term programs, they are given cases every day except for like maybe festivals or Sundays. Apart from that, they get to do almost every day. So the continuity will be there, and they'll be like in constant surgical touch. I think which does wonders when you actually learn. Our next thing is the program regarding SACS. We usually train them in superior SACS. We start them to do CCC during SACS itself. Then the hydro procedures, we encourage to do both hydro dissection as well as delineation in SACS. Then we convert them into temporal SACS. Then we teach them PCR management. And this one all is basically very important when they want to convert a phaco. For example, any complication during phaco, then they have to convert immediately to SACS. This helps them a lot, learning SACS before phaco. And regarding phaco program, we do temporal clear corneal incisions, and we teach them during the orientation classes itself the phaco-dynamics of both the peristaltic and venturi machines. During phaco basic training, we teach them to manage the nucleus, automated IA, complication management, and then at last they are given the difficult cases like moderately small pupil or pseudo exfoliation cases, which they can do on their own, and then they can also manage if at all there is a complication from those cases. This is our protocol for the short-term program. We separate them into 4 stages, and each stage they are incrementally given one additional step, from incision, then rexus, then hydro procedure, then automated IA, then they introduced to phaco with trenching. They are given foot switch coordination. Then at the end of the stages of learning, they are given the complete phaco procedure. The short term is for 2 weeks. This is the shortest fellowship program we offer. From day 1 to day 14, this is how they are trained. From the first day, they just observe, and second day, they get to know the machine and the machine parameters and the phaco-dynamics of the machine. Then third day, they start scrubbing and they start assisting, and they also practice foot switch control. From day 5, they'll be given hands-on wound construction, rexus, trenching, and then they'll also be asked to convert to SACs. Then from week 1, they'll be given small the initial nuclear fragments. They can remove the last piece where you have a raised incidence of PCR, so that they'll be asked to remove the initial 1 or 2 or 3 fragments of nucleus. Then they'll be trained in Simcoe removal of cortex. Then slowly by second weekend, they'll be taught even the chopping techniques. This is the timeline for long-term programs. By 2 months, they'll be trained very well in SACS and RICS. By 4 months, they'll be trained to do all basic steps of PHECO. By 6 months, they'll be completely trained to do PHECO on their own. In 8 months' time, they'll be able to manage simpler complications of PHECO. And by 10 months' time, they'll be able to do not very difficult, but some difficult cases like small pupil and pseudo exfoliation, then post-vitrectomy eyes, like that. And by 12 months, they'll be fully trained in PHECO, including managing complications as well as to do in difficult cases. First thing is the experience. These are the highlights. Basically, the first thing is the experience, the uniqueness of our programs, and the guidance they get. We have trained more than 2,000 budding ophthalmologists and fellows since our start of these programs. And hands-on surgical training will be there on all days. There will be a lot of emphasis both on technical as well as practical training, and both will be on equal footing. It's not that like they'll be taught only theory and techniques and all that. They don't being offered practical training. It will be equal. They'll be taught the techniques. They'll be taught the PHECO parameters. They'll be taught the PHECO dynamics, as well as they'll be given practical training. And then we offer world-class microscopes like Lumera 700 and the very high-end Leica microscopes and PHECO machines like Centurion and Stellaris Elite. They'll be provided that for the training from almost day one itself. And we issue certificates at the end of all the programs, whether it's short-term or long-term. And we record all our training videos. And all the videos, whether it's complicated, whether there was a complication or whether it went on normally, we discuss it. And we guide them for further refinement of the surgeries. Guidance, trainees will be guided on all the steps which they find difficult. Some will be very good in PHECO, but they'll have very much difficulty in IA. Some will be very good in IA, they'll have difficulty in PHECO. So we guide them in all their difficult steps, and we approach in a stepwise fashion till they master and they are able to do it on their own. Complications management, we teach them, and also we train them under supervision. And in summary, our PHECO training at Rajan Eye Care is flexible regarding duration for individual trainees, and it's comprehensive from basic to cutting edge with the latest machines, and it will be personalized, guided, and it will be complete. And thank you. And I'll show some of our trainees' videos. These are all done by our own trainees. This is divide and quant work, which we teach them to start with. Then later on we go for chop and all. We encourage them to do separation with two separate instruments rather than the PHECO head tip itself. Even in divide and conquer, we give them the choppers, so they get used to that, the instruments. And remember, these were all done by fellows, our fellows. And in Rexes, we teach them both needle as well as utrata forceps. Both techniques we teach them. This is the last video of SACS being done. We teach them Rexes right from SACS, so it'll be like easier to do when they start with their PACO program. Thank you.
Thank you, sir. It's a wonderful presentation. And see, so how many fellows do you take for each? I mean, you have different programs, right? So
Yes.
so what is the waiting list? Like if I apply for a fellowship, short-term fellowship or a long-term fellowship, how long is the waiting list as such?
Like we take around just 1 or 2 people every time, so that the training will be very personalized. They can apply to Rajan Eye Care office, and when the slot comes, they'll be allotted. So there is no separate exams or something like that. They have to apply whether they want short term or long term, and depending upon the vacancy, they'll be intimated accordingly.
No, see, I mean, you have separate programs, right? Long-term program and short-term program.
Not more than 2 for each program, sir.
For each program, you take 2, is
Yes.
it?
Yes, sir.
So that is okay. Like so, at a time, there'll be different programs running, right?
Yeah. So
So how many would be there? And sort of like for long-term fellowship, is there because I mean it has to, once 2 people are taken, the next 2 will be taken after 1 year only, right? So
yeah.
so what is your advice, like for somebody who wants to, because of the kind of training that you give, I saw like you have really structured one, and I'm sure that all who have got trained from there are doing really well. So what is your advice? So you go to, how do they apply? They go to Rajan Eye Care website and
yes,
apply?
sir. Yes, sir. They go to Rajan Eye Care website, then they apply for the fellowship, and depending on the vacancy, they'll be intimated accordingly. Whether what they opt for the candidate will intimate them accordingly. The vacancy position, yes.
Okay, that is fine. And so like if I apply now for a that very short term fellowship, so there is a possibility that I might get it in 2 months time or 3 months time.
Yes, sir. Yes, sir.
So that is really wonderful. And see, as you would agree, and I would agree, and everyone would agree, Dr. Mohan Rajan is a legend, and he's such a wonderful surgeon. It's a treat to watch his surgeries, and so he's a lovable person, and so we would all like to see him as the president of AIOS. That's that's one thing, and we would like him to continue with the passion that he has for teaching. And please take him to ask him to take a proper rest. When he is a workaholic, he might not take rest.
Works from
And,
morning 6 to night 8, sir, all days.
Yeah, that's why he said. 3 days back, I said, Sreeni, I can't get up. I'm having so much pain. And yesterday or yesterday, I called him. No, Sreeni, I worked full day. So this is a kind of. But please ask him to take rest. And thanks a lot for your presentation. It was a wonderful presentation. I'm sure that it's going to be useful to a lot of people. You've given a lot of information out on the training program that you have there, and I'm sure you'll have. I'm sure a lot of Malayalis are already getting trained there, and you'll have a lot more coming there after seeing this program. Thanks a lot. Thanks a lot.
Thank you.
Thank you. And now we move on to the training program at Shri Ganapathi Nethralaya. It was I didn't really have a contact of Shri Ganapathi Nethralaya, and it was my dear friend Dr. Prashant Bawangle who gave me the contact, and so it's great, really great to have Dr. Abhishek Desai from Ganapathi Nethralaya. See, you should understand that there is a DNB exam going on there, and they have they have to arrange for accommodation and everything, or even for the examinees who are coming, and you all understand that you have to arrange the cases for that, and he's academic in charge there, and but he really has taken the pains to do everything and come and join our program. Thanks a lot, Dr. Abhishek. And so Ganapathi Nethralaya is a 101 bedded not-for-profit multi-specialty eye institute run by Maiko Research Foundation Trust, and it has completed 30 years as a really wonderful eye institution serving the Jalna district of Maharashtra. It is one of the biggest and best registered eye care centers in Western India, and it offers a lot of training programs, DNB, fellowship, FACO training, and BSc in optometry. It's a recognized center for DNB. Currently, there are 7 DNB students in the hospital, and the hospital also offers its own fellowship program on merit basis. And currently, there are 10 candidates pursuing fellowship program, and they have a wonderful FICO training program. It's a 1-month residential training program. So it's a wonderful training program that they have. And I'm sure that it's going to expand to other major training programs. And regarding Dr. Abhishek, he has FRCS, MRCS, and FERS, ICU on retina. Is currently working as senior consultant in vitreoretina and ocular trauma and DBS services. As Sri Ganapathi Nethralaya is a PG teacher, academic in charge, and the program coordinator of DNB ophthalmology, and definitely he would be a great teacher for all of us to really explain the training program that runs in Sri Ganapathi Nethralaya. Dr. Abhishek, can you start your presentation, please? Dr. Abhishek? Dr. Abhishek, you're muted.
Yeah, am I audible now, sir?
Yeah, you're audible now.
Sorry for the inconvenience. Thank you, Dr. Sreeni, for wonderful introduction and kind words. And thank you once again for giving us this opportunity. I would like to thank Kerala Society of Ophthalmic Surgeons for this honor. It's really means you guys are doing great job. I'm following your YouTube channel since last 6 months, and I'm also telling my PGs and fellows also to subscribe this channel and keep watching the notifications.
Dr. Abhishek,
Yeah.
I think your internet is a bit unstable. What you can do is you can switch off your video so that your voice becomes clearer. Just can switch off your video.
Okay, yeah.
Okay.
Yeah.
Now you can continue, please.
Yeah.
You're not clear in the beginning.
Okay, now am I audible, sir?
Yeah, absolutely.
Yeah. So, sir, I was telling, I'm following your YouTube channel since last 6 months, and I'm recommending it to my PG fellows since last 6 months. You guys are doing great job. Hats off to you. And I think the content over this channel is going to be helpful and useful for coming decades for all aspirants and those who are practicing in the ophthalmology. Thank you.
And thanks a lot, Dr. Abhishek.
Yeah, now
you can share.
I'll be sharing my presentation. Sir, is my slide visible?
Yeah, slides visible. It's full screen. You can start, please.
Yeah. So good evening, everyone. I'm Dr. Abhishek. On behalf of Ganapathi Nethralaya, I'll be speaking on cataract surgery training opportunities at our hospital. As Dr. Sreeni has introduced, it was established 30 years ago, and we moved in our current premises in 2001. It's an NABH fully accredited tertiary eye care charitable trust hospital located at Jalna district in Maharashtra. In last year, we have seen almost more than 122,000 patients in our OPD clinics and operated more than 12,000 surgeries in a year, out of which 2,300, that means 20% of the surgeries are done total free of cost. So that means fellows here get a good hands-on during their training. So we do have a DNB and fellowship program which was started in the year 2000. Until now, more than 65 candidates are enrolled for DNB and 108 candidates have completed their fellowships. Coming to the different kinds of fellowships that we offer at Ganapathi Nethralaya, first we'll see the long-term fellowships. In anterior segment, we offer fellowship in almost all subspecialties of ophthalmology, including cornea, oculoplasty, pediatric ophthalmology, glaucoma with 1 seat each. And comprehensive or general ophthalmology, we offer 4 seats, 2 in Jan session and 2 in June session. Apart from it, we do offer 4 seats for retina, 2+2 in Jan and June sessions, which is 24 months. All the anterior segment fellowships are of 18 months duration. Only thing in comprehensive or general ophthalmology, we offer candidates who are about to finish their fellowship a 6 months optional fellowship in their choice of subspecialty in anterior segment only. So if some of the fellow, they want to continue, they want to have some additional exposure in cornea or pediatric ophthalmology, they can join the respective department for the last 6 months. They will be there for additional OPD clinical as well as surgical exposure in that particular subspecialty. In all the anterior segment subspecialty, they get all types of cataract surgery, inclusive of extracapsular cataract extraction surgeries, SICS, and phacoemulsification surgery. Except for retina, they don't get on a routine basis. If there is something cases which are a little complicated or where they need to have a vitreoretina backup, so those cases are allowed to do by the retina fellows. So the selection criteria for long-term fellowship is a MCQ test related to their subspecialty of choice, followed by the personal interview. We don't charge any fees for the long-term fellowships. We do provide a stipend of around 25 to 30,000 rupees per month. The accommodation that we provide is out of the campus. It's a shared bachelor's accommodation and it is free of cost. The leaves permitted throughout the year for our long-term fellows are 12 in a year. And the candidates who are joining for the long-term fellowship, they don't have to sign any particular service bond, or they don't have to commit anything after with the institution after completion of their fellowship. So the working hours are from morning 8 a.m. to the evening 6 p.m. with 3 to 4 emergency duties in a month where they have to stay in the hospital for that particular day. For application, they have to apply on this email ID or on our website. And then we inform them whenever the interview date or exam date gets finalized, we intimate them over the email. So now coming to the fellowship, as with many institutes, I was going through this video series. Our fellowship program is more or less similar. So I will not highlight the similarities. I will try to highlight the differences that what we offer. Along as with the most of the places, we do have our initial induction program where we teach them about the NABH basic training regarding the different codes that we follow, fire safety training, CPR training, our EMR software training, and our hospital institutional ethics, work ethics, and OT culture. Other than that, we do our fellowship is a nice blend of clinical rotation, academics, and surgical trainings. For those fellows who are selected for the subspecialties, they are rotated within their department of their specialty, and those who are selected for the comprehensive ophthalmology, they are rotated on a monthly basis in different specialties like plastic, cornea, glaucoma, pediatric ophthal, and retina. So they get exposure to all specialties. Now coming to the surgical, and then the surgical training starts. We do have a well-equipped library facility for our fellows, where we have all the latest editions of the books and journals, both in digital and the hard copy format, along with good IT backup and internet facility. Also, students have excellent audiovisual support and classes for their academic activities. Coming to the surgical training generally for the long-term fellows, no matter how many surgeries they have done during their post-graduation, we start from the ECCs. If they don't have exposure of any kind of surgeries at all, in the beginning, we train them over the dummy eyes or goat eyes, or those are those eyes which we received in eye donation, which are not suitable for the surgical use. So we train them on these dummy eyes for initial section making, side port making, initial steps, suturing before starting the ECC. Once their suturing is approved by the trainer or the consultant with whom they are posted, then they are shifted over the human eyes. So initially, to begin with, they are trained in the ECC. Once they master the ECC, they are gradually shifted to the SICS. Initially, they do a few steps. Once they master each step by step, then they will be allowed to do independent complete surgery, initially under supervision and then independently. Similar is the case with the phaco's. Once they master the ECC and SICS, we train them in phaco's. Initially, the phaco surgeries would be done with the tunnel at the limbus, and then gradually they are shifted to the clear corneal. And in the last 3 months of their fellowship, we let them operate the phacoemulsification under topical anesthesia as well. So most of our outgoing trainees or outgoing long-term fellows, they are very or super confident in topical phacos as well. So I think this is a very good learning experience they get here. Apart from that, the fellows do observe and assist the senior faculties in the operation theaters. We do have a case-based approach and discussion. So we have our WhatsApp group where the fellows get the MRD number of their allotted patient in the prior evening. Suppose the fellows have OT tomorrow. In the today evening, they receive on their WhatsApp the allotted case MRD number. So the patient is admitted in the ward, so they can go back in the ward and thoroughly see in the evening how is the case, how is the cornea, pupillary dilatation, grading of the cataract, whether the eye is a deep socket or not. So they can have the surgical plan in mind, and before starting the surgery, they can discuss with the trainee or the faculty with how they can approach with the case. So I personally feel this is a very good approach, and they have to maintain their logbook. Currently, we are having a physical or hard copy of logbook, but our IT team is in process of making a digital version of logbook which can blend in with our EMR. So once the MRD number of patient, if you feed, then you automatically all visits data will be pulled up in that portal. So we can track easily what was the visual acuity before surgery, what was the refraction before, and how was the surgery, are there any surgical complications. We are trying to fit the certain few keywords about the complications like iris prolapse or Descemet's membrane detachment, PC rain, nucleus drop. So once that in OT nodes, they have been filled, so automatically those keywords will be identified and they will be pulled up in the complications section of that EMR. And every visit's data will be automatically pulled and saved. So it will be it will save the time of our fellows, and as well as the proper documentation of every event will be done, and it will be easy to monitor and to analyze the performance of every student or every fellow during their tenure. So we have a case recording facility in all the theaters. We have almost 10 operation theaters with us, and we have a case recording facility in every theater. So we have a excellent infrastructure. We have all the different FECO machines with us, like Constellation, Infinity, Centurion, Laureate, Earthly, Hummingbird. So those who come for the short-term training, they have some plan in mind to operate and to buy this particular company's machine, so they can practice on that particular machine. Or they try, many of the short-term fellows, when they come for a month's time, they try their hand in almost every machine, and they can judge or they can decide for themselves which one to go by and which will suit in their setup and their budget. So that is the one added advantage, that having a different companies machines with us. And during their, for all long-term fellows, during their tenure, it is mandatory for them to have at least one presentation in national level conference and one thesis or project to be submitted for publication before the completion of their fellowship. Even if it gets rejected, that is fine, but at least they should submit or complete their project somewhere. As per with all the institutes that we have seen recently, we also follow the Oscar grading system for all types of cataract surgeries for our long-term fellows. Once they get a adequate or minimum desired score in one particular technique, and then only they will be migrated or shifted gradually over the next level of the cataract surgery. So the training program at our fellowship programs, we try to achieve not only the good surgeon, but the clinicians, so that they will be able to manage the patients confidently or independently when they go out of this place. Recently, after COVID era, we used to get a lot of queries for the short-term training programs. Initially, we did not have this, but during COVID, most of the postgraduate students were posted for their COVID duties, and their residency programs have been fired during their COVID duties, and they could not get a ophthalmological enough surgical as well as the clinical exposure. For them, the comprehensive ophthalmology is good. Also in Maharashtra, the students have to serve for a government bond 1 year after their completion of MBBS and 1 year after completion of their MS. So apart from their medical education, they have to serve 2 extra years for the government service or government duties. So recently we have seen most of the students who have finished their bonds are not very keen on doing long-term fellowship, because many of the girls and boys, they get married, many of the girls, they have kids. So for them, it is not possible to pursue a long-term fellowship. So we started post-COVID this short-term 1 month paid FECO or SICS training program. It is a 1 month duration, and we charge them 75,000 rupees course fees plus 5,000 in campus accommodation. Till now, we have trained more than 45 candidates, and for the procedure is to apply is to email over this email or apply through our website. Generally, the waiting period for this fellowship is 2 to 3 months. As per with most of the institutes that we have seen earlier, we also offer one-to-one training during this course, and they have all the recording facility. The case plan will be discussed earlier and even after also. If they get stuck up in any particular step, then trainer comes and rescue you through that step, and again the case will be handed over back to the trainee. So that way this program runs. So this is how we offer the fellowship programs at Ganapathi Nethralaya. And once again, thank you KSOS and Dr. Sreeni for giving this opportunity to us. Thank you.
Thank you. It was a wonderful, like you have really systematically explained everything. See how it goes there and everything, Dr. Abhishek, and thank you for that comprehensive presentation. And so if somebody from anywhere like applies, they'll definitely get a training opportunity in 3 months. Is it?
Yes, yes, sir. Yes, sir.
Okay. And how happy are those people with that comprehensive fellowship program? Like in the comprehensive fellowship program, like in the last 6 months, they get the specialty training, right?
Yeah, if they are willing for it, it's not a mandatory for them.
But it would be great to do it for anybody.
Yeah.
So do they get like if they opt for via fellowship, do you offer that, or it's just an anterior segment fellowship that you give in addition to the cataract surgery?
Sir, we don't offer VR fellowship. We just offer the anterior segment fellowship.
Okay.
Because in 6 months, we feel it is difficult to teach them settling retinal detachments or macular holes or anything. So we offer them anterior segment fellowship. So they do get some, if someone, because what happens is most of the times they are confused that they don't know where their interest lies when they finish their residency. And if they don't have a good exposure in their residency, they don't know what exactly ophthalmology is and which area they are inclined in. So at the completion of their comprehensive fellowship, many of them found interest. Some found in cornea, or some people find it in the glaucoma or pediatric. So accordingly, means we ask them at the end of their fellowship whether you want to pursue optional 6 months or not. Even if they don't opt, that is fine. They can leave and start their general practice, or if they opt for any particular subspecialty, they can join. And during those 6 months, they can get enough hands-on in that particular specialty.
See, may I suggest something, like because I am somebody Abhishek, with an ear on the ground, like I like from Kerala, we basically socialists only. Okay,
Yeah.
so see what I've seen is that there is, if somebody goes into practice, see, it would be great to have a good exposure and good capability for a medical retina practice along with cataract. So that I feel if you're really actually going for, see, I know that they can do nothing on VR surgery in 6 months. Absolutely nothing. Like by the time they are good with they interact and all those things, lasers and all, it'll be at least 6 months. So I feel that like a comprehensive in which a medical retina fellowship is a part would be would have a lot of takers, and it would do a lot of, it would be really helpful for people. So you start your own practice, you have you do cataracts and you do retina. It'll be good for patients also. So that's one suggestion. Otherwise, you have an absolutely a wonderful structured program there. And as I said, like it's just starting, and it's going to be really great in the future. I'm sure that your institute will be a much sought after destination with you there. I'm sure that you're going to be there for a long time. Like
yes, sir.
yeah.
Yes, sir.
So thanks a lot. Thanks a lot. Thanks a lot for joining us. I'm sure that you're going to have. So there is one question. Do you have an oculoplasty? There's a question from the YouTube. Do you have oculoplasty fellowship in Ganapathi Nethralaya?
Yes, sir. We have one seat for oculoplasty fellowship in Ganapathi.
So what is the duration of that?
18 months, sir.
18 months. Yeah. This is oculoplasty is probably a one fellowship which is going to have a lot of demand in the future with all those aesthetics and all coming in. And see, like if you look at state of Kerala in Kannur and Kasaragod districts, you just have effectively one part-time person who is doing oculoplasty. Though there is a huge demand. Everything, like even in my hospital, we refer everything to our Calicut branch. So that is one specialty which is going to have a lot of demand in the future.
Yes, we have a very nice oculoplasty training program at our place. Almost all branches, even right now also, we have a very nice exposure. We take almost 4 fellows in a year, and we operate on an average 400 retina cases in a month. So we have a huge workload in retina.
400 retina cases in a month. That's a huge number.
Yes.
Humongous number. That's great.
Yes.
Yeah.
So and even our all entry segment fellows, before finishing their fellowship, they are super confident doing topical phacos as well. So it's I think which is a very great thing in current scenario where patients are very demanding. So they don't have to work anywhere else once they finish this fellowship program. They can straight away from start their own clinical practice once they finish here. So that is the thing that we have heard from feedback from our outgoing fellows.
That's really wonderful. Like I mean, you have such a wonderful program, and you have give so much of exposure. I'm sure, like this is going to be. I mean, I'm sure it is now, but I'm not really exposed to the training program in that part of India. But this is now people know in my state and all across India that what is going on there, and I'm sure yours is going to be a much sought after destination for fellowship. Thanks a lot. Thanks a lot, everyone. All the institutions who joined. Dr. Ramandeep. It was Zibin. You were there for Abhishek. You were there for Dr. Ramandeep's presentation, right? It was a masterclass presentation. Like everything that you want to know about simulator, everything, that structured program. So I actually approached him about 2 weeks. I said, "No, Dr. Sreeni, I want some time." And so now I realize why he wanted so much time, and we did a wonderful presentation. And everyone, Dr. Mamatha, everyone did a wonderful presentation. Thanks a lot. And all those youngsters would be highly obliged to you for sparing your time for them. Thank you. Thanks a lot.
Thank you so much, sir.
We'll end the